It's going to work on YouTube. Great. Okay, so now that we're there, I have one other technical duty to take care of, and then we are going to begin our presentation. Hopefully, maybe a minute or two early, but we were hoping to start at 11:33 through to 34. So give me one moment, and we will get this party started. When you're a small nonprofit, you have a lot of administrative duties to take care of while you're putting these things together. So just give me one fast second and we'll get everything nice and organized for you all. And we're going to go here, muted, and share to our Facebook page. And now I can't share to Facebook either, Ross, so I don't know what happened there. So much for that. We will just be on YouTube today. All right. We are going to get started in just another moment, and I will do a screen share with you in that moment. We have a number of individuals who will be joining us for a Q&A session. They'll be joining on shortly, and we will bring them all onto screen at the appropriate time. We have, our numbers are kicking up there. So nice to have you all here today. So my name is Lisa Salberg. I'm the founder and CEO of the Hypertrophic Cardiomyopathy Association. And it has been my privilege and honor to serve this community for the past 27 years. For those who do not know, I come from a long family history of hypertrophic cardiomyopathy, including my own diagnosis at the age of 12 and a heart transplant 6 years ago. So HCM is something near and dear to my heart, pun intended, but we have so much work to do within the space. We need to make sure that we are getting all of our children evaluated and screened, and we are looking at all of our elements of the potential to identify children and families with cardiac disease so that we have the opportunity to get there in time to make a change. In the next few minutes, you're going to hear two stories of people who didn't get there in time, and we're trying to explain what we can do to make a positive change. So I am going to share my screen, and I am going to start the presentation at 11:32. So I'm 2 minutes or 3 minutes earlier than I had expected. I'll use those minutes up later. Okay, so HCM Awareness Day was something that we started just last year. It's our second annual HCM Awareness Day. We have had different proclamations and laws recognizing HCM awareness that were a little scattered, and we're getting it all organized to the fourth Wednesday of every Heart Month, which is February, so that we can all join in together and learn a little bit more about HCM and focus on what we can all do together to make it a better future for those with HCM. And this year, all other genetic cardiovascular diseases. So I have an introductory message from one of our state senators, Senator Tony Bucco. Please listen to his story. It's not what you expect. Good morning. I'm here with Senator Anthony Bucco from the state of New Jersey, and I'd like to welcome him to the program and let him tell us a little bit about why he's interested in hypertrophic cardiomyopathy and the Healthy Cardiac Monitoring Act. Good morning, Senator Bucco.
Morning. It's great to be with you this morning. This is certainly a topic that touches so many lives. It's estimated that 1 in every 500 people may be impacted by hypertrophic cardiomyopathy, and it can be a silent killer. And in fact, it was brought into my life because my father was diagnosed with it and had been treated for it and was taking medications as a result of it. But we only found out about it by coincidence. He had had some chest pains, and we were actually at a sporting event when it occurred, and he had an angiogram. And that's when they discovered the thickening of the wall in the one chamber of his heart. He was one of the lucky ones, though, because he was diagnosed with it, and it didn't impact him as a child. We've seen throughout the country a sudden cardiac arrest, which is attributed to this disease. and in many cases. So it's important for us to take the lead in our states as legislators to make sure that our children are screened and tested, and that the right questions are asked, not only before they participate in sports programs, but for all kids, because you never know when this could have a devastating impact on your life. And so that's why in New Jersey, my father and I, we had the privilege, and I had the privilege of serving in the legislature together. He was in the Senate in the upper house at the time, and I was in the assembly in the lower house in New Jersey. And we helped champion this legislation in New Jersey in 2014 that would require questions to be answered, uniform set of questions to be answered of young student athletes before they took the field. And this way, if the questions were answered in a certain way, they were referred for further testing before they undertook the rigorous role of being a student athlete. And then later on in 2015, we thought to ourselves that this needed to be expanded. This shouldn't just be limited to student athletes, but to all kids. And that's why now in New Jersey, when you go for a child exam, a wellness exam, you're asked these questions to be able to see if there's family history, if anything puts out a warning sign to the pediatrician to say, hey, we think you might be subject to this, and we'd like to do some further testing. No family wants to find out when it's too late.
Exactly.
And that's what this is all about. And just recently, just last week, I introduced a Senate Joint Resolution 119, which would make hypertrophic cardiomyopathy Awareness Day here in New Jersey on the fourth Wednesday in February of each year, so that it brings awareness, because this is not something that you hear about every day on the street, but it is something that has the potential to affect many, many families because it is genetic. So I had to be tested. My children had to be tested. My grandchildren were tested as a result of my father having the disease. So it has a major impact on families, and I'm just happy to be able to play a small role here in New Jersey. And I would encourage the legislators throughout the country to follow New Jersey's lead and do the same thing. Let's get out there and save some young lives.
All right, thank you so much. That was so well said. I didn't even have, this subject so well because it's impacted your family, and hey, we're local. So you followed the HCMA's work all these years, and I'm very happy to say that your dad and I work behind the scenes on a number of issues, but this is the first time we're speaking publicly about your dad being affected by HCM, and your dad was a wonderful servant to this state for many, many years. So just paying him some appreciation on HCM Awareness Day for his role in our success and our ability to impact the lives of others. So I look forward to continue working with you on this, and thank you for speaking to your fellow state legislators around the country on HCM Awareness Day.
Thank you for the work that you do. Keep up the great work. Let's spread the word, and let's make this uniform across the country and across the world, because it is critically important. No family should have to suffer, but some families have suffered as a result of this disease going undiagnosed.
Couldn't agree more. We need to get there, and we need to get there in time. And that tees us up for our next part of the conversation. So thank you very much for joining. And now let's hear about Jillian's experience with hypertrophic cardiomyopathy. So thank you to Senator Bucco for spending some time with us earlier this week to share his thoughts on HCM Awareness Day. I want to just pay some appreciation to states who have recognized HCM Awareness Day through either law designated by STARS or resolution or proclamation on the left side of your screen. And we're expecting some action today from those other states. So big shout out to Connecticut, New York, Colorado, Texas, Iowa, Indiana, Arkansas, and yesterday, California, or Friday, California. And we're hoping to hear today from Arizona, Illinois, Kentucky, Massachusetts, Michigan, Nevada, Utah, Georgia, and Minnesota. So we are all in this together, no matter where your state is, we are all in this together. There is HCM in every state. Over the next few minutes, I'm going to tell you a little bit more about why the act is important and how easy it's going to be to move this initiative forward with all of your help. So this is the hard part for me because this story was relatively new to us this month. I met Amy Blair, Jillian's mother, and she very bravely offered to share this story. So in the next few slides, I'm going to tell you the story about Jillian's family and how Jillian's life is a bit of a puzzle. And we are going to take a very broken puzzle and we're going to put it back together in such a way that we can stop this cycle of loss. So let's explain exactly how this puzzle broke. It's a little bit complicated, so stick with me for just the next few minutes. I'm going to tell a family history story and we're going to have some illustration. So back in 2005, cousin Dan is diagnosed with hypertrophic cardiomyopathy as a young child, adolescent, and he goes on to have his first open heart surgery. But his diagnosis was kind of in a bubble and the family did not understand how genetic HCM could be and how his diagnosis may impact the lives of others in the family. So much so that 10 years went by and his father was diagnosed with a valve problem and had surgery in a low volume surgical program. And that led, unfortunately, to his dying of complications from his surgery. So over time, the family history grows and Aunt Kathy has some problems, but there's other things going on there, so we move on. In 2017, mom, Amy, is diagnosed with atrial fibrillation. As a healthcare practitioner herself, she asks, could this be related to my family history of hypertrophic cardiomyopathy? And was inappropriately told, no, that's not what you have, you just have AFib. They were also told by other practitioners along this time that HCM was a male-to-male penetrant disorder, which is not true. Men and women can have HCM. So there was some misinformation being circulated. In 2000, oh, by the way, she has 3 children, 3 daughters. In 2018, cousin Dan goes back and gets some genetic testing, gets results that he has a pathogenic known mutation for hypertrophic cardiomyopathy. But that information did not proliferate through the family tree. It was still in a silo. We just know this now because we're rebuilding the story. In 2021, Jillian went for a well child examination and had a well child exam under Iowa law. The features would be consistent with Iowa law, which does not include cardiac questions. And everything was clear in June. She goes back in February of 2022. So literally like a year ago, right around now. And they detect a murmur. And then we have a conversation. Oh, by the way, cousin has hypertrophic cardiomyopathy, and there is this aha moment. So now we have to schedule all of the testing, not only for Jillian, but for mom, because wait a minute, if Jillian has a murmur and might be at risk for HCM, isn't mom also at risk for HCM? So they go in March and they get those tests done, and both of them become diagnosed with hypertrophic cardiomyopathy. Genetic testing was performed, but that takes a couple of weeks. So in this particular case, there was no urgency seen because there was no urgency seen. We're just going to work this up and we're going to get to the answers of what the treatment should be when we get all of the details. So those details came in on April 21st, 2022. Amy gets a phone call in the morning saying, we found the same gene in your daughter and you as we have it found in your cousin or nephew, Dan. And now next week we'll work on, this is Friday afternoon. we'll get to you next week and we'll figure out what's next. This is the hard part of the story because timing here was crucial and missed. Jillian came home from school that day. Mom had a conversation with her about two things. Number one, they found the genetic marker. And number two, Mom had found the HCMA and found Center of Excellence care was available and that they were going to go for a second opinion at a Center of Excellence. Jillian said, great, I got to go to work. I got to water my flowers for work today. She went upstairs to go get ready for work. And Mom went out to the backyard to do some chores. After a few minutes, Mom notices her car has not moved from the driveway yet. And as any mother would do, walks inside, hey, where are you? No answer. Goes upstairs and finds Jillian in full cardiac arrest on her bedroom floor. Mom screamed out the windows, which were open, to a neighbor who was a nurse and happened to represent an AED company. So she had AEDs with her. She ran in with the AED. They shocked her 3 times. They did get a beat back temporarily, but by the time EMS got there, it was no beat to be found. And sadly, Jillian passed away on the very day that she found out her genetic test results. There was no time to get in an implantable defibrillator to protect her from sudden cardiac arrest because the time from murmur detection to getting all the data together was just too short. So let's take a look back at how this timeline could have gone a little bit differently. Let's put the pieces back together. But before we do that, I forgot about this slide. These are the real people. These are the faces of this particular family. I put up a pedigree to make it easy, but these are real people. These are families. These are people in your community. They look like everybody else. They don't have a big mark on their face that says we have heart disease and we're at risk. These are real people. So how could we put the puzzle back together of Jillian's story? In 2005, when the first HCM surgery occurred in the family, there could have been communication and there could have been a conversation with the chosen healthcare provider about what the implications of a family history of HCM meant. Another opportunity came in 2015 when that valve replacement, which probably was done in a program that it shouldn't have been done in because this was complicated HCM care, there was another opportunity for a discussion. When Mom asks her doctor, does my atrial fibrillation have anything to do with hypertrophic cardiomyopathy? The answer is yes. 25% of people with hypertrophic cardiomyopathy will have atrial fibrillation at some point in their life. There is a connection, but the healthcare provider was unaware of this fact. Through better education through healthcare practitioners, we could change the conversation there. When Cousin Dan's genetic test came back in 2018, if that information was proliferated through the family and given to the family practitioners so that they could do genetic testing on other members of the family, maybe in 2018, we would have identified that Jillian was at risk and they would have gotten to a center of excellence sooner for proper risk evaluation and ICD implantation. That didn't happen. In 2021, when that well child exam happened, if the doctor asked the questions in Iowa that she would have been asked in New Jersey, we could have asked, is there a family heart health history of hypertrophic cardiomyopathy or other genetic heart disease? Yes, we would have been able to intervene in June of 21, and given the echo results of February, March 22, there would have been clinical indication of HCM present and the time to do more to get to care in time. If in that February 2022 that's supposed to say well child exam, not sports physical, little typo there. If that murmur was detected or that action had taken place months earlier, we would have had ample time to get all the test results and get the device put in time. We missed that opportunity. So when that echo was done, when the genetic test comes back, if the timeline were just a little bit different, there would have been time to save Jillian's life. So what can we do to save Jillian's life and stop memorials of young lives like this from being commonplace, from something diagnosable and treatable? This young lady was eclectic and special, and I love the story her mom shared with me about how she wanted to hear the new, I guess it was Harry Styles album. And you have to listen to vinyl from the beginning to the end because that's how the artist intended it, she would tell her friends. So instead of hearing the album herself, her friends went graveside and played the Harry Styles album for her. That's not how this story should have ended. She should be dancing around and singing to her favorite star, dressed as eclectically as she wishes. So if I didn't convince you enough with Jillian's heartbreaking story, I want to share another story of another face of HCM that looks a bit different than Jillian and her family. I want you to meet Derek Armstead. Derek's mom passed away before the age of 30. And he had never been evaluated for heart disease before. Nobody ever asked about his family heart health history. One day in 2020, he passed out while playing with his tiny little nephews under the age of 10. And he passed out and he went to the emergency room. And they told him, well, it sounds like maybe you had a seizure because he shook after he had passed out. Well, he was in cardiac arrest, we now know, but he revived himself, probably by the hit to the ground because he fell quite hard. But the ER sent him home without any cardiac tests being performed at all. This is a 28, 29-year-old Black man, over 6 foot tall, looks like the picture of health. So he gets sent home without any testing. And then a couple days later, he goes out to run some errands and he has his baby in the car with him. Something tells him he should go home and drop off the baby before he continues to run his errands. He carries the baby up the stairs in the car seat, puts the baby down at the top of the stairs, and collapses in full cardiac arrest. 5 days later, he's declared dead. Nobody ever checked his heart. Had we been asking about family heart health history during his childhood, or even when he presented in the emergency room in full cardiac arrest, maybe we could have done something different. So we have multiple ethnicities affected by HCM. Every ethnicity is affected. Every community is affected. I guarantee you, if you're watching this and you stop and you think about people you've lost suddenly in your life, or people you know who are struggling with heart problems, there's a really good chance that somebody there has hypertrophic cardiomyopathy. So now I'm going to play a little message from our chair of our legislative committee, the Elizabeth T. McNamee Legislative Committee of the HCMA, Beeler Dowse.
Hello, my name is Jillian Dowse. I'm a board director at the Hypertrophic Cardiomyopathy Association and the chairperson for the Elizabeth T. McNamee Legislative Advocacy Committee of HCMA. One of the most exciting initiatives, I might say, is the Healthy Cardiac Monitoring Act, in short, HCM Act, which is designed and set up to save children's lives. The Legislative Advocacy Committee is one of the standing committees of HCMA, and it was formed in October 2019. Currently, we're made up of 10 active members. 2 of our members, Lisa Solberg, CEO of HCMA, and Julie Russo, the volunteer coordinator of HCMA, are the actual staff members. The names of the 8 active volunteers, including myself, are Rosemary Conlon, who is the vice chair and co-lead of the HCM Act, and others alphabetically are Scott Boracas, Lindsay Davis, Isaac Rodriguez Chavez, Bill Rossi, Dr. Aaron Troy, and Judy Zerden. We are all passionate about improving the healthcare needs of all HCM patients. We will work hard to improve the existing policies and advance legislative decisions that positively impact the healthcare delivery systems and issues for all HCM patients. You can always find more information about us at the HCMA's website, and I sincerely encourage you to do so. Thank you very much for giving me the opportunity to talk about the Elizabeth T. McNamee Legislative Advocacy Committee of HCMA and our incredible initiatives. Hope to see you soon.
So now let's get into the basics here. What is the HCM Act? It's actually quite simple. We want to include cardiac questions to be added to the well child examination for all children under 19 that are consistent with the American Heart Association, American College of Cardiology pre-participation screening physical for student athletes. We know that not just athletes are affected by heart disease. We know all children and all people are at risk. So the points that were brought up, excuse me, by the scientific committees of these well-established organizations are where we find our start. And I'm happy to say we have the support of the American Heart Association and American College of Cardiology in our efforts to move this piece of legislation forward. We would like to improve professional development for healthcare providers with an online training system. We've created one here in the state of New Jersey. It was quite cost neutral. Many volunteers took part in presenting or putting this curriculum together. And we would be really happy to assist states in making sure this remains budget neutral by working with our industry partners to help maybe sponsor some of the testing CME requirements that will be needed to ensure that we have that kind of educational opportunity for healthcare providers. We also want to take the opportunity to improve the student athlete pre-participation screening, physical, and education, like we've done here in the state of New Jersey. And I know you're all not from New Jersey, and maybe you don't like the way we do everything here, but this one, because we live here, this is where we started our initiatives, and they're working quite well. So what we do here in the Student Athlete Protection Act of the state of New Jersey is ensure that coaches, parents, and student athletes get a flyer every year that tell them what the risks are and the signs and symptoms of heart disease are, so that they can communicate clearly with each other whether or not they're having a problem, as well as ensuring that there's only one form per state that's used so that we have consistency in our data collection and evaluation of student athletes. And we want to improve the ability of healthcare providers to identify children and families at risk for genetic and congenital disorders and help them make appropriate referrals. Not every family practice doc is capable of doing an echocardiogram in the office, so they need to make referrals to the cardiology programs within their community. This is the basics of what we're trying to do here. We're not looking for massively different changes to the law. We just want a couple of questions to be asked. What are those questions? Glad you asked. This is the 14-point elements of the AHA cardiovascular screening for congenital and genetic disorders. Is there chest pain? Is there unexplained syncope, passing out or nearly passing out? Is there exertional chest pain or fatigue or palpitations with exercise? Has there been a murmur detected? Has there been elevated blood pressure? Has there been a prior restriction of sports activity or physical activity? Have you had any other tests for your heart? Is there premature death of somebody before the age of 50 in your family attributable to heart disease? Is there disability in your family from heart disease young? Do you have HCM, DCM, long QT, other channelopathies, Marfan syndrome, or other arrhythmias or certain cardiac conditions that run in the family? And for the physician specifically, how to listen for a heart murmur. Sounds easy, but if you don't do a standing, sitting, and squatting, you can miss some of the heart sounds that come from HCM and other diseases. We're looking for the femoral pulse to be evaluated, if there is an appearance of Marfan stigmata, and we're looking at brachial blood pressure monitoring as well. These are pretty simple questions. Mom and dad, while they're sitting in the doctor's office filling out the questionnaire before they go in to see the doctor, can answer a lot of these questions. The 10 of them can be answered. And then that's a conversation between the healthcare provider and the family. So what number of people are we talking about affecting here? With the population numbers estimated at about 329 million in the United States today, and 22% of them are thereabouts being under the age of 18. 19 was really where we're capping this off at, because that's where Well Child ends. We know that we're talking about 72 million people will have an opportunity to evaluate in their Well Child exams, as long as the parents bring them for a Well Child exam. This chart here shows you the prevalence rating of these different disorders with the high end and the low end. Some diseases we're still trying to figure out exact prevalence, so we're working with a kind of range of numbers here. So what does this really work out to be? This is adult and children, because it's very hard to break out prevalence by that. So 22% of these numbers would be in children roughly. So we're looking on the high end of 10.5 million Americans being diagnosed with any of these conditions. So those triggers would be in the well child exam for other family members to be screened. And on the low end, somewhere around 3.5 million individuals. So having the opportunity to screen those individuals, we're not looking at 329 million. We're narrowing it down to people who have symptoms or have disease in their family, and we can identify them more effectively and get them to the care that they need. So what do we need from you, the state legislators? Well, we need bill numbers, and we have draft legislation available at 4hcm.org. And one of my staff, I'm sure, is going to drop that in the chat link, and we're going to go to Q&A in just a moment. So you can have a look at that draft legislation. You can set up a call to talk to our team about any details about the draft legislation. We have gone through this very carefully. We have sent it out to the American Heart Association, who has given us a thumbs up that they will support this initiative in any state that it's brought forth. So we have really good partners, which I will talk about in just a second. So we need bill numbers. We need to get it in front of the proper committees. We need a few champions out there to help drive this in each state. We need to get it to the floor for a vote, and we need to get it signed into law. This is a bipartisan issue. I am assured of one fact: no matter what your political party is, y'all have a heart, and y'all have families, and y'all care about people. So this is one of those things that we can all agree upon is important, and we want to make sure everybody's hearts are safe. So we're looking forward to hearing from you all on how you can champion with us. And we'll be reaching back out to you after the webinar to set up follow-up calls. If you're watching this presentation after the live version, you can email us at support@4hcm.org, and one of our team members will get back in touch with you as soon as possible and arrange any follow-up calls necessary. We are really proud to have amazing sponsors on HCM Awareness Day, including Bristol Myers Squibb, who's taking the lead in this initiative, but also Cytokinetics, Pfizer, Embria Therapeutics, Embria Pharmaceutical, Tenaya Therapeutics, BioMarin, and DeVib Tech. And we have so many awesome nonprofit partners out there as well. Patch, the Arrhythmia Alliance, National Forum, ASC, AHA, ACC, Heart Failure Society, Heart Voice, In a Heartbeat, Heart Brothers, Global Heart Hub, and I am a proud member of the HCM Society's board of directors as well. So we don't do this by ourselves. We do this in a community of other organizations that really care about heart disease. So I am going to ask some people to come up on screen with me now. If we can bring up, and we're going to stop the share here for a second. If we can bring Amy, Ethan, and Biller onto screen. So hello, everybody. I'm going to ask, there we go. We have Biller, and we just have Dr. Rowan coming in. And I'm sure he'll be here in just a second to join us live for any Q&A that you may have. So I'm going to start with a question of my own to Dr. Rowan, who's coming to us from Leahy up in the Boston area. Dr. Rowan, can you explain how important it is to talk about family heart health history?
Lisa, and you know, as always, thanks for raising awareness for HCM. It's critical. What we know from an HCM standpoint is that the earlier diagnosis we have for patients, the better patients do. And so this type of bill really helps allow recognition for HCM early in pediatric patients to get them in to allow them to have the right treatment.
Biller, if we could ask you a little bit about the work of the committee. This language did not come up easily. There were some deep conversations and a lot of editing, and it took a solid year to make sure that we were hitting the mark properly. Can you tell us a little bit about the process? You're on mute.
Sorry about that. And as you just said, it took a while. We started with the basics, looking and reviewing what kind of laws have passed and what was going on in other states. And then we took New Jersey as our, blueprint to start with, and combining with all of the necessary elements. It was put together, then it was reviewed by the medical experts, and we made sure that every aspect, what needs to be covered at the well child visit, as well as student athlete pre-participation, was included. And it was, again, confirmed later on by the American Pediatric Association in their own policy letter. It was a confirmation we're doing the right thing. And then we actually started sharing it out with the states. And our first state, if you would like me to go to it, was really working with New York. And New York had a similar law that was in place, the Dominic Murray law. And when our HCM Act came, they were in a very busy legislative period. But what they did is they took the aspects of the HCM Act and put it into an active memo as of this year's July 1 to be effective, and all those questions and the proper screening to be completed at the doctor's offices.
Fantastic.
Thank
Amy,
you.
I kept you for last to bring into the conversation because you're the one that has the most ability for me to cry. You want to tell us a little bit about your daughter?
She had impeccable style. She wanted to be a fashion designer. She wanted to be an interior designer, a graphic designer, anything that dealt with design. And she played the guitar. She said, you only need to learn how to do 3 chords and you've got yourself a hit song. So we had to listen and suffer through many 3 chords of hit songs that she thought she had. She was wonderful. And, I'm here today because there isn't going to be a bill that is going to be written to save my child's life, but my child can save others' children's lives, the lives of legislatures, their children, their grandchildren, their neighbors' children. Jillian's death can save thousands. And that's the truth. And this is an easy bill. It should be an easy sign. I don't want next year to come along and have this day here and have some other mother sitting here saying, sign the bill, get the bills passed. Because I'm telling you, it's an easy one to do. And Jillian could save thousands, not tens, thousands.
I couldn't agree more. I couldn't agree more. Our question and answer box is open. If anybody has a question or a comment they would like to share, that's where we will be addressing all of the comments. I know somebody raised their hand earlier. We aren't going to be bringing anybody onto microphone. So if you want to ask a question or make a comment, please use the Q&A box in the bottom. So I want to go back to Dr. Rowan here for a moment. The American Heart Association 14-point screening for heart disease. How long have we been using this tool? I know it used to be 10 points and they added 4 more on. How long has this tool been utilized and how effective is it?
I can't tell you the exact date, Lisa, but it's been ongoing for decades at this point, a modification of it. Like any screening tool, it is not perfect by any means, but it does a really good job in identifying most individuals at risk for HCM and other heart disease as well. And so this has really been for a while, what everyone in the cardiology community is recommending is the first line for screening for cardiovascular disease in younger patients.
And giving the physicians the opportunity to, number one, learn a little bit about why we're doing this questionnaire and what actions would be then reasonable based on the results. They can then make the referral to cardiology. And let's just take a moment here to discuss the differences between what might be found in this well child exam and which test might be necessary for an individual. Some diseases need EKG to diagnose, some need an echocardiogram, some need a CT scan to diagnose. Can you explain why it's important to leave that into the decision-making of the physician and the cardiologist that's brought in?
Yeah, so also want to talk about education. If you could remind me to go back to that also, Lisa.
Will do.
But as you said, this isn't, this is raising awareness, hopefully leading to referrals to the right people to make sure people are getting the right testing. For HCM, that's an EKG and an echo to start. But for blood pressure and concerns about coarctation, that's an MRI or a CT scan for evaluation. So it's not, okay, there's a red flag for one of these questions, you need XYZ tests. There's a red flag on one of these questions. This is the right next test for evaluation.
So we do have a question that is asking, would this screening have the potential to pick up a bicuspid aortic valve?
So as part of the screening is a auscultation for a murmur, which if there's a bicuspid valve, should hear systolic murmur as well, and thereby lead to an echo.
So generally speaking, yes, it
Yeah.
should, if somebody knows how to listen properly for that murmur. So Bryce is asking, how effective are public health surveillance tools for identifying and aggregating data about HCM incidence rates, diagnosis, and outcome? Do we think HCM continues to go unreported? Oh, yes, it does. I'm going to pick on you again here, Ethan. So we believe right now in the HCM community that only 15% of the identifiable patients are diagnosed. Would you agree with that number?
Yeah, think and minimal conservative estimates, as you were saying, is 1 in 500 in the US population. That would imply about 700 individuals are living with HCM. And to the best of our knowledge, our best estimates are about 150 to 200,000 have a clinical diagnosis of HCM, meaning at least 500,000 individuals are living with HCM without a diagnosis.
And that's dangerous, especially in families like Amy's or mine. We're out there. But what happens when we get patients to HCM care? What happens when we identify them and get them appropriate management?
Yeah, when seeing experts like the 48 HCM centers of excellence that you've helped establish and identify, we know outcomes are really excellent for the vast majority of patients. And HCM with treatment can really be associated with very low mortality and life expectancy for the majority of patients. That's no different than the general population. And with good, ideally quality of life for the majority of our patients with HCM as well.
So I am the rare. 5% of us will go all the way to heart transplant, but 95% will never get to a transplant and live a good quality of life with all of the tools that you're going to hear about today that are currently available in terms of treatment and centers. And there's so much that can be done today. And had we gotten, and I'm going to go back to Jillian and to Derek, had we gotten to them earlier and assessed their individual risks, we would have put definitively, based on the clinical background here that I've seen, a septal measurement of over 4, and in a family history where cousin Dan, by the way, his ICD had appropriately gone off. So this would have been an ICD implant when the patient had gotten diagnosed and had a conversation and was ready to make such a decision, which is a big deal. But we would have been able to put a device in and save a life. So implantable defibrillators have changed the face of HCM for many because they can live a very normal life. And those arrhythmia moments can just be a moment. I'm reminded by the story of another young kid. He's not a young man. He's a young man, but he's not a teenager anymore. He had an ICD put in, didn't want to do it, finally did it. 3 months after, his ICD went off. He didn't even know it. He thought he fell asleep, and he woke up, and then he was called by the center the next day saying, by the way, what happened last night? You were in ventricular fibrillation.
and he woke up and he went to school the next day and he didn't even know what happened. So technology is here for us. We just need to implement it properly. 2 questions. Tammy, I see your hand is raised. Please use the Q&A box. We'd love to get to your question. Stephen asks, as we talk to our neighbors and others about this disease and legislation, what has been the historic opposition or pushback by well-meaning people to this effort? What issues should we expect to arise that we need good, solid response to convert them? Here's the great news. In the state of New Jersey, when we started this initiative back in 2014, it went pretty quickly. We had the draft language. Everybody kind of got it. It first went to student athletes. We then said, excuse me, that's not really everybody. And we added the well child inclusion language. We didn't have anybody fighting it back against us at all. There was no negatives. Everybody just jumped in, including the insurance people, the insurance lobby, physician lobby. Nobody was opposed at all to the initiative. Why did things slow down? Well, that's my fault. As the founder and CEO of the organization, I got really sick after New Jersey launched. And in 2016, I was listed for my heart transplant. 2017, I got it. Then you might have heard there was this thing called COVID going around that really kind of rocked the world a little bit. So things were kind of sidelined for a while, and now we're back ready to go after the rest of the country. So I do not see that there is anything that we've gotten pushback on, with the exception of people being able to pronounce hypertrophic cardiomyopathy. But we work with them on that. Hard to say, easy to learn about. We make it easy. So Stephen, I hope that helps. Sherry, and then we're gonna have to move on to our next segment in just a moment. How can you help getting legislation passed? Well, that is an excellent question. Number one, you can go to our legislative link on the website, and there is a system that we use. It's called UJoin, and you can go onto UJoin, and 3 clicks can save a life. You can write to your individual state legislators through our system and ask them to engage. You can share your personal story. You can share a video along with that, and you can let them know that this is important to you and you want them to make this law in your state. So we've answered that. For those without healthcare coverage that will cover costs, they'll address that. I would hate to lose another child because the family can't pay for the tests. Signed by Jillian's aunt. So we know that state by state, there are different S-chip, so Medicaid programs that are available to children. And we know that the ACA specifically uses language that pre-existing medical conditions cannot be used against somebody for purposes of getting a new health insurance plan. So while we cannot ensure that parent will sign the child up for Medicaid, we know that these systems do exist in many states. Probably need to do a little bit more work there to ensure healthcare access for all. That is critically important. So I'm glad that you brought it up. And I'm going to talk in just a moment about how we can get people to HCM care through the Lori Fund, which provides travel stipends to those programs. Well, now the questions are flying in. I have HCM and twin 15-year-old daughters. How often should they be tested? Should we get care at a center of excellence for initial training? I'm always going to advocate for getting center of excellence level care. The echoes are more specific, they're more detailed, and you have a higher level of expertise at a center of excellence. I'll be putting up a list of those in just a few moments. Andy, I would encourage you to contact the HCMA office. We'll make sure that you're aligned with the right resources and that you and your children have the opportunity to live your best life possible with great care. Okay. Dr. Isaiah, I know who you are. We just talked. You're a family physician, recently diagnosed. Can you advise getting screening EKGs for new kids? Maybe we can catch a lot. EKG doesn't take long. I suspected this question was going to come up, and that's why I asked Dr. Rowan to come here. There's a very specific reason we did not include a specific test to be included in the HCM Act, because there are multiple different tests that might be required to identify different disease states. Ethan, could you please talk about the false positive, false negative, and the problem of both false positives and false negatives with global EKG screen at this time with today's technology?
So with today's technology, and obviously in the future with AI, maybe completely different, 5 to 10% of individuals will have a quote unquote false positive ECG, meaning that out of 100 or out of 1,000 people, 100 would have an EKG that's abnormal, which would lead to an echo. The vast majority of those would not have structural heart disease and would have a normal echo. And obviously, that's a huge burden in terms of cost for the healthcare system. In addition, an EKG can provide false reassurance. About 10% of HCM patients have a normal EKG, and does not help identify other diseases that we're concerned about as it relates to sudden death in young individuals. For example, anomalous coronary arteries, coarctation, all of those can have a normal EKG. And so I think that's really the reason for having the questions and letting the questions really guide more testing as a initial red flag.
I think that was really helpful. I will put this out there to say that new technology is being developed, and there may come a time where the technology is better that we could add that language into a piece of legislation, but the technology is not there yet. It may be someday. There are community efforts that do screen children on pop-up screenings, but we have a belief here at the HCMA that healthcare should occur in the confines of a doctor's office to ensure a number of different issues in terms of reproducibility of results, that your medical records are stored with your chosen healthcare provider, and that your anonymity, your privacy is maintained. If you go to a group screening, you're not always going to get the same level of privacy that you would get in a doctor's office. So we want to ensure that relationship is maintained and we actually keep healthcare in a doctor's office. I often use an analogy. We're looking for needles in haystacks, but we don't want to go build haystacks to go find needles. We have the haystacks already built. They're your doctor's offices. So let's use the existing healthcare system to use some common sense questioning to help elevate understanding of HCM and other genetic and acquired heart diseases, that they occur in young people. I was 12 years old when I was diagnosed. I didn't look like a cardiac kid. I was just a kid. You can't tell who has HCM. You can't tell by the color of your skin, your ethnicity, your economic status. We all have it. It's everywhere. Somebody asked how many people get defibrillators with HCM. It's approximately 25% of those with HCM will need an implantable defibrillator. Not everybody needs one. Not everybody is at high risk of sudden cardiac arrest. And that's a really important question. So thank you for asking that. I was going to answer it in writing. Okay. Amy, any final thoughts before we head off to the next section here?
No, I think that, what you guys are doing is very important. And HCM really isn't, on anybody's mind until it's on their mind, until they find out that it's lurking in their family. And some families can get by, pretty unscathed, but others like mine, it just knocks us down like dominoes. And so
we didn't talk about another piece of your family tree, and I got a lot to get in one day.
Oh,
but we talked briefly about Kathy.
Yep. So I have a sister, Kathy, and she was 68. She died the night before Jill's birthday in 2022. So just a few months ago, just 22 weeks after Jill had passed away to the day. And she was so excited. She was sad that she wasn't going to be able to make it to our celebration for Jill. And she died a couple hours before Jill's birthday. We can't say, because there was no autopsy, was it HCM, what exactly what it was, but the HCM gene, was detected, and she had been in failing health. She went very fast, just complained of a headache, took a Tylenol, and was gone. She died of a broken heart. And, that's unfortunately HCM, when they rob you of family members, other family members do die. If they don't have HCM, sometimes they die of other things. It just takes people down. So you guys are doing great things. And like I said, these bills should be easy. I don't, save some lives.
Thank you for sharing your daughter with us today.
Sure.
This was hard for both of us to put together because it's so heartbreaking, but I think Jillian is going to be a catalyst for change. So thank you for having the bravery of sharing your daughter's story with us so publicly.
I hope so, and thank you.
Thank you. Okay, Bielor, Dr. Rowan, thank you so much for joining us for this segment. We're going to get on to talk about Centers of Excellence and a couple of other initiatives of the HCMA. So you're back onto my screen share here now. And I want to give a shout out to our staff, our board of directors, and all the fantastic volunteers we've had over the past couple of years. Right now, we have over 400 individuals signed up to volunteer with us this year. Last year, we had over 100 volunteers give over almost 3,000 hours of labor to help our cause. So much thanks to all of you, and special shout out to contractor Josh Green, who produced the video at the top of this segment. You'll see it again later in the day. So what is a Center of Excellence? It is a comprehensive multidisciplinary program housed within a high volume center that they can provide the best care for patients with hypertrophic cardiomyopathy. We started this initiative around 20 years ago, and all of those lovely logos you see on your screen are our Center of Excellence partners. So if you are a legislator coming to us from one of the states out there in the country and you see something here that looks familiar, we are located in many states in this country. Not all, but most states have a Center of Excellence or several. So here is what the map looks like right now. You see there's some blank spots there, but we're working on it. But this is where our current HCM programming lives today. And right now we have an estimated 55,000 individuals with HCM that we know of that are housed in HCMA recognized Center of Excellence care. So we encourage you, if you have HCM, to find one of these centers, and the list continues to grow. This is something we don't typically show publicly, but we thought it would be important today to share with you where we've gotten inquiries from that we are working on currently. So this list here from Bethlehem, Pennsylvania, all the way through Fairfax, Virginia, are states and cities that are looking at centers. We are not giving the name of those centers yet. We have 3 international sites in Israel, Brazil, and China. We have applications in process for Cincinnati, Pittsburgh, Dansville, Pennsylvania, Georgia, Washington, Canada, which will be our first international, Connecticut, and Missouri. And in the past year, we brought onto our network New York Presbyterian, Columbia Irvine Medical Center. Leahy Hospital was transitioned from the Tufts program over to Leahy, University of Colorado, and most recently, not formally announced until this moment, Le Bonheur Children's Hospital in Memphis, Tennessee. So welcome aboard to all of the new programs, and we're really excited to work with some of these other programs and get everybody on the program and get patients housed at a high volume Center of Excellence care, because we know that's where they get the best treatment. If you do not have financial ability to travel to a Center of Excellence, the HCMA a year and a half ago, or a month ago, created the Lori Fund, actually named for my sister Lori, who we lost in 1995 to HCM. We have collected enough funds to provide up to $600 in travel stipends to individuals seeking care at an HCMA recognized Center of Excellence. This includes trains, planes, automobiles, gas money, hotels, food on the road, anything you need to go to a center. The application is available on our website, and we do encourage you to complete an application if you have a financial need. Next, I want to talk to you about a challenge that we are issuing. So we're going to pivot from legislative to action. You can also look at this piece of work, and if you are a lawmaker, you may want to consider legislating drilling for cardiac emergencies. We know that CPR and AED utilization are critical to survival. We also know that most people don't think about it every day. Somebody's going to go down and I'm going to have to react. We know that the NFL game heard around the world, Damar Hamlin's very visible cardiac arrest brought everybody's attention to the problem of cardiac arrest. But I want to go back 33 years ago, and I want to talk about something some of you may not have even heard of. A gentleman named Hank Gathers had a known diagnosis of hypertrophic cardiomyopathy and was given approval to continue to play basketball for Loyola Marymount. Unfortunately, during a game on March, I believe it was 9th, 1990, he took a shot, went half court, put his hands on his knees, had a look on his face like something was wrong, and collapsed. His coach and others gathered around him and looked confused. There were no AEDs in 1990. Chain of survival was known, but nobody thought that somebody who looked so healthy a moment ago could be in full cardiac arrest. But Hank Gathers died in front of many people, and it is on film. Nobody started CPR. They cried as he died and took his last breath. And instead of an action plan, they carried a deceased individual off of the basketball court. Heartbreaking. And 33 years later, DeMar goes down, and we learned from Hank and others who've been lost on the athletic field that the team responded very well. There were hands on him in about 10 seconds. There was an assessment. The AED was brought. Good CPR was done. And we watched it play out. I do hope that the NFL does release that video because it is a success story, as we all know. But when you have a cardiac arrest in a workplace, on a little league playing field, in a school, at your workplace, at your church, at your community gathering, what do? Drill Dr. Hart is the opportunity for y'all to sit together and discuss what are the laws in my state, who can legally do CPR, who has Good Samaritan coverage for using an AED, and what are we allowed to do in school or on the sports team? What are the rules of the organization, the company, the school, etc.? So we've turned this into an online challenge platform. Drill Dr. Hart is drilling for that cardiac emergency, having those conversations in advance, creating an action plan, ensuring that those on the team, somebody has CPR training, you know where the AED is located, automatic external defibrillator. If there's not one in your building, you may want to consider getting one in your building. If you are not going to get one in your building, you need to know what EMS response time is, because every minute that goes by when somebody's in cardiac arrest, you're 10% less likely to get them back to life. So the time matters. So the drill is simply this: plan it, practice it, film it, and post it. And for each of the 4 categories that we are looking for, and that would be sports, schools, workplaces, and community events and gatherings such as houses of worship or community centers. Each one has a chance of winning a free AED. If you get the most engagements for your post, you can win a free AED. The drawing will be held on April 23rd, 2023. So we encourage you to learn more about Drill Dr. Hart at our website. You can come on tonight. We're going to be talking a little bit more about it with the co-sponsor, the co-founder of Drill Dr. Hart, and Dr. Matthew Martinez will be with us live this evening to discuss this. So please come, learn, practice it, do it. If you're a large company and you don't need your AED for yourself, if you win for the business category, you can donate the AED to a community event if you would like to. Okay. So in case you were wondering if you want to, you're feeling philanthropic at the moment and you're inspired by the work we're doing here at the HCMA, this QR code will take you right to a donate button and you can make a donation to the HCMA. So we would appreciate that on our 2nd anniversary of HCM Awareness Day. And it helps us do the work that we're doing here every day. So now we are going to pivot into the next segment here, and we are going to start learning about many of our HCMA recognized centers of excellence. I'm going to turn off my video and microphone so you don't hear any background noise for this, but I will be here the whole time. So if you have any questions, please feel free at any time during today's conversations to post them, and we will address them at appropriate breaks. And now we're going to hear from our team at Morristown Medical Center and the Shannon T. Mast HCM program, one that I'm particularly proud of because it's in my neighborhood. And maybe I used to get my care there, and my family does. So here we go.
Hello, HCMA and HCMA community. Hello, HCMA and HCMA community. We're excited to broadcast to you today for HCM Awareness, Advocacy, and Action, I'm Matt Martinez. I'm the director of the hypertrophic cardiomyopathy program and the sports cardiology program here at Atlantic Health System and Morristown Medical Center in Morristown, New Jersey. So we are, of course, located in the densely populated northern New Jersey area with easy access to New York City and Pennsylvania. We have been able to leverage the Atlantic Health System and Morristown Medical Center and all of their cardiology expertise and the quality of care locally to expand to a center of excellence. We've been able to use our elite level imaging. We're performing thousands of cardiac MR and CT stress testing, echoes, and nuclear imaging every year on HCM patients. We have a seasoned arrhythmia team with lots of expertise and experience for handling HCM. And of course, we have a world-class surgical and structural heart program where both our surgeons and our interventionalists have expertise in handling those with hypertrophic cardiomyopathy. We started in 2014 after a generous gift from the Mast family. We are the only named center and the only named center of excellence in the United States. And I believe we remain the only hypertrophic cardiomyopathy center of excellence in the state of New Jersey. This was, of course, started in collaboration with Marty Marin and Barry Marin and Ethan Rowan from Boston. And we've been able to expand on that with their continued partnership. In 2019, we expanded our services and became a full-time weekly clinic, including inpatient services and expanding our availability for interventions, arrhythmia management, and a collaboration with NYU for advanced heart failure. Those expanded services have allowed us to expand to about 2,000 patients total last year in 2022 with HCM specifically. We are considered a center of first hypertrophic cardiomyopathy fellowship in the United States last year. We'll have another fellow joining us this July from the Mayo Clinic, and we are expanding to include not only HCM, but also sports cardiology as a one-year hands-on fellowship. We couldn't be more excited to try and generate the next generation of those with interest, excitement, and expertise in both hypertrophic cardiomyopathy and sports cardiology. We're passionate about safety for those who are exercising. We have participated and expanded on something called the Heart of a Champion, where we educate communities and organizations about sudden cardiac arrest during sport using hands-only CPR and AEDs. This is us presenting to the PRO, which is the Professional Referees Organization. This is 300 of the world's elite level referees, many of whom were on the field during the FIFA and in the World Cup games, and we'll continue to do that. And we do that with a collaboration with the Lorfing family, who has helped sponsor us so that we can provide AEDs and education about sudden cardiac arrest worldwide. We just recently published this here for patients, for school nurses, for athletic trainers on exercising in hypertrophic cardiomyopathy. We want you to engage with your HCM Center of Excellence to talk about what a safe exercise plan might look like for you. It's individual. It requires you to engage with your local expert, and then helps you figure out the safe way for you to reduce comorbidities long-term from coronary artery disease, hypertension, hypercholesterolemia through a safe and exercise program that should really be designed with those with HCM expertise. So thanks for having us today. We're excited to be a part of HCM Awareness again. Enjoy the rest of the day. We look forward to hearing from all the other centers about what's going on around the world for HCM awareness, education, and safety. Thanks for having us.
Sorry about that little glitch there. I'm going to turn off my camera now so you can focus on our Center of Excellence partners.
Hello, my name is Shep Weiner. I'm the medical director of the HCM Center at NYP Columbia, and we're excited to be participating in HCM Awareness Day 2023. We're a newly recognized center of excellence by the HCMA as of June of last year, and it's been a privilege to participate in some of the programming that the HCMA puts forward, including today's activities. I'm the medical director of the HCM Center, as I mentioned. I've been doing that for about 5 years. Prior to my involvement in the center, we were led by Dr. Matt Moore, who's a heart failure cardiologist now specializing in restrictive cardiomyopathy, specifically amyloidosis. And I took the program over from him, and I've been happy with the progress that we've made in terms of the patient care experience that we have at Columbia, the surgical expertise, and some of our research efforts. I'm joined by Dr. Hiro Takayama, who is our surgical director, who is a true expert in cardiac surgery, including septal myectomy and mitral valve repair for HCM patients, and Dr. Jay Shimada, who's our research director. The approach we try to take is really a teamwork model of HCM care, where we work together to provide the best patient care experience for HCM patients. We try to coordinate the patient experience. Patients will come through and see me, and then have any of the available subspecialties that are required in their management. And an important part of this is communication and collaboration between team members, and really a respect for individual needs and preferences. A shared decision-making model is one where we employ, where we want patients to understand their conditions and be active participants in the decisions that are made with respect to their care. We're pleased to have been involved recently in clinical trials that have made it an exciting time for HCM patients, including the Explore HCM study, which led to the approval of Camzyos from mavacamten for the relief of symptoms in patients who have obstructive HCM. We're also an active investigator site for the Sequoia trial, looking at the second generation molecule, aficamten. In terms of education, in partnership with the HCMA, we were excited last month to be a presenting center for the Big Hearted Warriors Unite program, where we led an evening of presentations to further educate the HCM community about some of the exciting advances and also challenges that we still have in managing HCM patients. Again, a day like HCM Awareness Day is another wonderful opportunity to further those goals and improve the experiences of patients who have HCM. So it's a pleasure to be joining you today, by video, and really look forward to continuing to work with the HCMA in the future and available to meet the needs of any HCM patients that require specialty care for sometimes complex decisions that are required for management. Thank you. Bye-bye.
Hi, my name is Dr. Mark Sherrod, speaking to you here from NYU Langone in New York City. I wanted to tell you a little bit about our HCM program, and also tell you about our staff. So all we do is take care of HCM patients, and we've seen about 2,500 to 3,000 since the program began about 32 years ago. We have, I'm fortunate enough to have a gifted surgeon who works with us, Dr. Daniel Swistel, and I guess I'll tell you about him first. So not only is he good with his hands and technically skilled, but he's also very smart, and has come up with some great innovations, particularly for patients who need to have something done for their mitral valves, as well as extended myectomy. The idea is to prevent SAM from recurring, and sometimes it's important to shorten the mitral valve. And towards that end, he invented the plication procedure for the mitral valve, the horizontal plication, and more recently has excised the very tip of the mitral valve in patients who need it, which are about 40% of the patients who have myectomy at the same time. We believe that the combination of the two procedures together is an important adjunctive combination to get good outcomes, not only at rest, but with exercise. Dr. Daniel Macera is my medical colleague who sees patients in parallel with me, who's been with us for 4 years. And Daniele is both meticulous, careful, and extremely patient, going on at great lengths to answer patients' questions and to explain options for them. From a research point of view, his paper on mitral annular calcification as a contribution to SAM is pretty much of a milestone. Understanding how that particular pathology can contribute to obstruction. He's also led some of our industry drug studies here, investigating novel treatments. Nurse practitioner Maria Reuter was an ICU nurse before she came to us. So you can imagine she's pretty much unflappable, as well as extraordinarily empathetic, and has been investigating as a leader the benefit of weight loss for our HCM patients, and in our IRB approved study has now enrolled 55 patients looking not only at symptom benefit, but also wall thickness improvement. Nurse practitioner Woon Woo came to us from the electrophysiology lab here at NYU, and so she is extremely experienced at atrial fibrillation, which can occur in about 25 to 30% of HCM patients. She worked under the tutelage of our lab director, Dr. Larry Chinitz, and when we have a patient with arrhythmias, she knows what to do and how to help the patients, so it isn't reinventing the wheel. We have 3 research coordinators. Isabel Castro Alvarez came to us from working as a research coordinator at the Bellevue Emergency Room. If you can imagine what it's like helping homeless people in that emergency department. I think it helped her focus and avoid distracting interference, which has come in extremely handy here in her lead of our drug studies. Isabel has to pay extraordinary attention to detail in documenting the activities of and improvement of patients who receive the investigational drugs that we have been fortunate enough to study. Elizabeth Edelstein was a college student at Hunter when she first started to work for us, and she's in charge of our registry and also some of our investigator-initiated trials. And she did such a good job as an undergraduate that we hired her directly out of college, and she's done a bang-up job in these studies of investigating our own independent ideas. Richard Scher has joined us more recently. Richard worked as an investigator at another hospital in Manhattan, but was a phone researcher and indicated that he wanted more personal contact with patients. And he started to develop that skill here at NYU, where he's meeting with patients as they come through our center. As far as office staff, if you're here, you'll meet Christina, Zeta, Crystal, Wanda, and Sandra, who I hope you'll find to be as sympathetic as we think they are. In summary, in any great adventure, if you don't want to lose, victory depends on the people that you choose. So if you're a patient of ours now, great. If you want to see us in the future, please call us and we'll try to help. Thank you. Bye.
Just a programming note, I'm running into a little bit of multitasking problem here with my Zoom today. So my team is going to try to address the questions in the Q&A box for me, because every time I move my cursor off the screen, you all get a frozen screen. So the answer to the question currently posed, which states have enacted HCM Act? prior to us naming it HCM Act, New Jersey put the program forward back in 2015. And last year, New York took the features of the HCM Act and embedded them in the Dominic Murray Act. So we are basically in 2 states at this time. And the draft language has some additional topics from lessons learned over the few years and the other programs that we put together. So again, it was delayed because yours truly couldn't drive the ship because I was off getting a new heart. So we're back now. So let's get on with the day. Okay, next up we have a message and a patient story. This one's very special. You'll see why in a few moments. So this is Stacy's story. I'm going to mute myself.
My name's Stacy. I was diagnosed at the age of 7 at a family screening. I have a very significant family history of hypertrophic cardiomyopathy. Beginning of April of 2020, my device starts beeping that the battery is low, and I'm approaching my 36th birthday. I dreaded turning 36 for 26 years since my mother passed away because I was there that day when 911 was called when she had her cardiac arrest. Not only was my great-grandfather affected by HCM, so was my grandfather. He lost his battle to HCM due to heart failure. My aunt had a stroke in her 20s due to HCM. And lastly, my own mother had a cardiac arrest at the age of 36 and passed away when I was just 10 years old. And I've had 3 implantable defibrillators. My first one was at the age of 19. My last one, it's a little bit of an emotional part. I couldn't go into the hospitals at that time to have my device replaced. I couldn't even go in to have the sound turned off. So every day I had to listen to that notification. And I ultimately had my device replaced 10 days after I turned 36. I think I thrive and do the best that I can. I've participated in past trials and eager to move forward with HCM and see what we can do to prevent unnecessary deaths like I've had in my own family.
I'm sure you can see why that was a slightly emotional story for me too. Stacy is my niece and my sister's daughter, and I think it was really amazing that she shared her story at the American Heart Association Scientific Session 2022, and is one of our partnership programs with HCMA and AHA. And now I think you're going to hear from AHA directly.
Hello, I'm Marielle Jessup, a heart failure specialist and the Chief Science and Medical Officer at the American Heart Association. The AHA is grateful for our collaboration with the Hypertrophic Cardiomyopathy Association. Together, we help raise awareness of and improve care for HCM, educate healthcare professionals, and help patients live a full and productive life. We look forward to continuing this important work.
And we are very happy to have AHA as a partner. And another big partner we have is Bristol Myers Squibb. As many of you know, they launched Camzyos or mavacamten effective April 2022 as our first labeled indication drug for the treatment of obstructive symptomatic hypertrophic cardiomyopathy. And now we're going to hear from Tom Garner from BMS.
Hello, I'm Tom Garner, Vice President and Head of US Cardiovascular and Established Brands here at Bristol Myers Squibb. This year, we are once again excited to join the HCMA in recognizing February 22nd as HCM Awareness Day, an important milestone for people living with hypertrophic cardiomyopathy. Patients are at the center of our work here at BMS, and we know advances are needed to help people living with HCM. That's why we're so proud to support the HCMA in their mission to improve the lives of patients. We want to express our thanks to Lisa Solberg and everyone at the HCMA who has advocated for patients with HCM by sharing what they face on a day-to-day basis. They've provided resources to patients, and they've also connected patients with cardiologists and nearby centers of excellence, while also connecting patients with each other so they may have additional support in their diagnosis journey. We know there's still much work to do, but we are energized by the potential of what can be done for patients through research and innovation in cardiovascular diseases, including HCM. At BMS, we are working closely with those affected by HCM to gain insights and knowledge that help guide our development efforts. Furthermore, we are leveraging key learnings and real-world data in the design of clinical trials, with the goal that our findings and medicines are relevant to the diverse group of patients we serve and the needs of clinicians. To say it very bluntly, we are determined to improve the management of hypertrophic cardiomyopathy for patients now and into the future. We value the HCMA's tireless efforts. They clearly share our vision and sense of urgency to ensure people with HCM have access to the care, education, and research they need. We're proud to support the HCMA on HCM Awareness Day and throughout the year ahead. Together, we are committed to establishing a world with better outcomes for those living with HCM.
Now off to Atlanta.
Happy HCM Awareness Day. My name is Robbie Williams. I am a general cardiologist and HCM specialist at Emory University in Atlanta, Georgia. I want to thank the HCMA and Lisa Solberg for inviting us to participate today. Our HCM Center, with our wonderful multidisciplinary team, has been caring for HCM patients for about 15 years now. This past year was definitely a year of innovation and new frontiers for us here at Emory. Like many programs, the highlight of the year was perhaps the introduction of mavacamten or Camzyos, and us as a program learning how to provide this new and exciting therapy for our patients. We've also been involved in clinical trials looking at new and exciting medical therapies, other direct myosin inhibitor therapies for our patients. Our busy surgical and interventional cardiology programs have been providing care for our patients, but our structural heart disease program has been working to innovate a potential new minimally invasive therapy for HCM patients known as the Sesame procedure, which is a myocardial scoring procedure that has been shown to potentially relieve left ventricular outflow tract obstruction without the use of alcohol injection. So again, I wish everyone a happy HCM Awareness Day, and I will pass it on to some of my other colleagues who will tell you more about our program here at Emory.
Hello, this is Olsen Bilan. I want to take this opportunity to thank HCMA for organizing this event and want to thank our patients and their families for trusting us with their care. At Emory Hypertrophic Cardiomyopathy Center of Excellence, we have a passionate multidisciplinary team that is dedicated to the care and diagnosis of patients with hypertrophic cardiomyopathy, and I had the pleasure of joining this team about 3 years ago. Along with my colleagues, we collaborate together with clinicians that specialize in the care of hypertrophic cardiomyopathy. And that team includes physicians and nurses from several cardiac subspecialties, genetics, cardiothoracic surgery, and pediatric cardiology as well. In addition, I am also very passionate about researching hypertrophic cardiomyopathy and giving our patients access to cutting-edge novel therapies and diagnostic modalities as well. In our center, we engage in multiple research projects and clinical trials that I think will help us understand hypertrophic cardiomyopathy at a deeper level and help patients with hypertrophic cardiomyopathy receive the best evidence-based care.
My name is Dr. Tamer Hataya. I am a board-certified cardiac surgeon at Emory University Hospital. I specialize in taking care of patients with complex cardiac conditions, including hypertrophic obstructive cardiomyopathy, which is also referred to as HOCM. In HOCM, there is an increase in the thickness of the heart muscle, and when this affects a particular part of the heart, it can obstruct the flow of the blood out of the heart. In addition, there is an increase in the stiffness of the heart muscle, and this can compromise the return of the blood from the lungs to the heart. Abnormalities of the mitral valve are also very common in patients with HOCM. I specialize in performing open heart operations in patients with this condition. I help my patients by removing a small part of the thickened muscle, and by that, help improve the blood flow out of the heart into the main artery of the body. This operation is referred to as a septal myectomy. Frequently, this can also help improve the leakage of the mitral valve. However, in certain patients, I may perform an additional mitral valve repair as needed. Here at Emory, we have a team of experts who focus on taking care of patients with this condition. And we are proud that we perform the largest number of septal myectomies in the state of Georgia, and we have excellent outcomes. I'm grateful to have the opportunity to help patients and improve lives. And I'd be honored to partner with you or your loved one on your journey.
And now off to the University of Maryland.
My name is Vincent C. I'm the co-director of the HCM Center of Excellence, an associate professor of medicine at the University of Maryland, and a cardiac electrophysiologist. And I'd like to introduce you to my friend and our center's director, Dr. Libin Wang.
Thank you, Winnie. It's a great pleasure to be here with you on this Hypertrophic Cardiomyopathy Awareness Day. You and I have known each other for more than 15 years. We have been closely working on hypertrophic cardiomyopathy since our research days in the Seidman labs more than 15 years ago.
We co-founded the program years ago and really orchestrated to be a patient-centered team and trying to emphasize care for both patients and their families. This includes obviously the two of us and a larger team that includes genetic counselors, geneticists, colleagues in cardiology, both pediatric cardiology and adult cardiology, with expertise in echocardiography, cardiac MRI, heart failure and transplantation, cardiac electrophysiology and heart arrhythmias, as well as cardiac surgeons, nurse practitioners, and others involved just to help the care of everything that patients need in their lives for HCM.
I've been working and thinking about hypertrophic cardiomyopathy for more than 20 years now, and ever since I joined the University of Maryland Cardiology Division, I started working closely with Dr. C, and we established the hypertrophic cardiomyopathy program and the Center of Excellence. We got recognized by the HCMA in 2018, and we have been working very closely with the Hypertrophic Cardiomyopathy Association.
And what we've heard from our patients and families is that they really appreciate this patient-centered and family-centered approach of comprehensive and multidisciplinary care here at the University of Maryland.
You know, over the years, we have been doing research, more basic research on hypertrophic cardiomyopathy, and now as clinicians, we're getting more into clinical research regarding hypertrophic cardiomyopathy. We have been involved in multiple clinical trials in advancing our understanding of hypertrophic cardiomyopathy and the treatment development of hypertrophic cardiomyopathy. It is well known in the community that hypertrophic cardiomyopathy is one of the most commonly inherited cardiac disease. It may in fact affect 1 in 200 to 500 people. We estimate that in the state of Maryland and the surrounding region, there may be about 12,000 to 15,000 patients are affected. Our job is to raise the awareness of hypertrophic cardiomyopathy. And over the years, again, with collaboration with HCMA and our great team that we have assembled, we have been reaching out to our providers in the Mid-Atlantic region to raise the awareness of hypertrophic cardiomyopathy. Our center had exponentially grown over the years, and to provide the most cutting-edge treatment and care for the patients.
Not only have we formed this great team to help take care of patients now, but we really look forward to strengthening our efforts to work with patients, their families, and the greater medical community in raising awareness, improving research, and improving care for hypertrophic cardiomyopathy.
Thank you so much for being with us. Thank you for HCMA to provide us with this opportunity to to tell the community our work, and we look forward to close collaboration with HCMA over the next coming years and decades. I will strive to provide the best quality of patient care in the Mid-Atlantic region.
They may get the award for funkiest music today. And now we're going to hear from the University of Virginia, and I believe we have Michael Ayers presenting.
Good morning or afternoon, depending on when you're listening to this. My name is Michael Ayers, and I am the co-director of the Center of Excellence for Hypertrophic Cardiomyopathy here at the University of Virginia. And I'm very excited on HCM Awareness Day to give you guys some updates about what's going on down here in Charlottesville. Before we do any of that, though, as always, I'd like to take a pause to thank the HCMA for their tireless effort to help both patients and families of those affected with hypertrophic cardiomyopathy. So thank you, as always. With that said, brief outline, what we're going to do today is reintroduce you to some of the team. If you've seen previous recordings, some of that might be a review for you. We're going to go through some updates about what we're doing here at the Center of Excellence, and we're going to talk about what might be next, briefly. For those of you who have heard me speak before, I like to discuss the 4 pillars of hypertrophic cardiomyopathy management, whether it's the genetic piece and how that affects loved ones, whether it's heart failure, which is another term for shortness of breath, or arrhythmias, abnormal rhythms from the top or bottom chambers of the heart, or if it's lifestyle. Whichever of these 4 pillars we're discussing, though, we really think of imaging as the linchpin to management, which is why we feel so fortunate here at the Center of Excellence that the co-director, Chris Kramer, our founder of our Center of Excellence, has really made his career in imaging hypertrophic cardiomyopathy. The gentleman to his left there is yours truly, the other co-director here at the Center of Excellence. Moving to the top right, we'll talk about Matt Thomas. We're very lucky to have Matt here. He is a national expert in cardiovascular genetics and helps patients and their families understand their risk. On the bottom right, we are going to talk about some of the more players here at UVA. The gentlemen in the bottom right-hand corner are Mike Ragasta and John Kern, who help us when we think we need a mechanical solution, whether it's through a catheter in the leg or whether it's through an open heart surgery to help alleviate some of the obstruction of blood flow out of the heart. And the gentleman in the center there is our Director of Transplantation and Advanced Therapies for Heart Failure at the University of Virginia, because as we know, sometimes this condition progresses and you need some advanced therapies. So we're lucky to have that robust option here at UVA when needed. On the bottom left, we have Pam Mason and George McDaniel, who are our leads on the electrophysiology or heart rhythm specialist side of things. And on the top left, we have our other primary deliverer of care outside of Dr. Kramer and I, and that is Dr. LeCoyer. And between the 3 of us, we really focus on not just your hypertrophic cardiomyopathy, but how your hypertrophic cardiomyopathy relates to exercise and other comorbidities. And if you've been to our center, you know that we cannot continue without mentioning the nurses who take care of all of these patients and really are tireless in their efforts. My nurse, Karen McLean, and Peggy Dame, just 2 that I'll mention. So in terms of our center, updates that we're excited about. We received a large grant to start developing a database that's going to be a living registry that communicates with Epic, our electronic medical record, to in real time follow our patients so that we can quickly analyze retrospectively how we're doing in different metrics. We also received a grant to study the effect of mavacamten, a cardiac myosin inhibitor, a new drug for obstructive hypertrophic cardiomyopathy, to understand a little more how this drug and how this class of drugs is going to affect microvascular health in patients with HCM, the small blood vessels. We're actively enrolling, though, in multiple trials, both with cardiac myosin inhibitors, interventional therapies, and genetic therapies. And amidst all of that, we've really developed a robust experience writing mavacamten. In fact, BMS has reached out to our center now on multiple occasions to travel around the country to talk about how we're able to prescribe this medicine so well. And we have an abstract at ACC, the American College of Cardiology, describing our experience in helping get this medicine to patients who need it for an affordable cost. This team that's working on mavacamten for us really consists of not just pharmacists, not just physicians, but also nurses and our echo lab to coordinate all of this care. We have multiple publications that are ongoing. In addition to the abstract I mentioned at ACC, we have 3 or 4 other ACC abstracts that we'll be presenting soon. And we have a paper that I'm very excited about that should be coming out soon that looks at how diagnosis, prognosis, management, and family screening changes when you move your care from a low volume center to a center of excellence, in this instance, UVA. We're also one of the co-principal sites for HCMR, which is a study looking at how the tissue itself changes in different therapies in hypertrophic cardiomyopathy, and we should be adjudicating or assigning results and reporting that out soon. And then what's after that? Well, in some ways, your guess is as good as mine, but I'll give you some thoughts. I think we're going to really start to see studies that are sussing out how cardiac myosin inhibitors compare in the prognosis and long-term outcome of patients compared to traditional therapies or myectomies, procedures where we're removing a piece of the heart muscle. We're going to get more robust family screening programs when we utilize databases like the one we're developing. And we're really hopeful that we're going to get some drugs in the pipeline soon that are looking at interventions on a genetic level for patients with early onset of their hypertrophic cardiomyopathy. This is just a brief review of all of the cast of characters here at UVA, where we like to say we deliver expertise to individuals and those they love, and we're really hopeful you take the time to make your family part of the UVA family. With that, I will pause, and hopefully I'll make a live appearance at this point, but thank you so much for your time.
As we are running very over time, our live appearances have been.
How's that, Stacy?
Oh. As we have run a little over time, the live appearances have been sacked this year, but we will be having some live discussion groups in session 2 this evening. So if you'd like to come be part of a little bit more of a conversation, please come later. We are peppering, you're going to see throughout the afternoon here. We're going to hear from a couple of centers, then you're going to hear from an industry partner, you're going to hear from an advocacy partner, and then you're going to hear a story of an HCM patient. In the first break, we heard Stacy's story, and today I'm going to bring to you Dennis's story, but we're going to do this one a little bit differently, just to keep you on your toes and it doesn't get too repetitive and boring. So Dennis is an 80-year-old man who was diagnosed with hypertrophic cardiomyopathy at the age of 77, and he had a significant outflow tract obstruction. He had lived a very active life up until his diagnosis, and he wanted to resume his activity, including bike riding and other activities. So he has asked us if we would share the facts of what he chose to do. And that is, he chose a trial of mavacamten or Camzyos back in September, October of 2022. And we could give a lot of, basic storylines, but we're going to look at his echocardiogram and we're going to see what happened and how he feels. So in 2019, in October, they did this echo, and I know this is probably Greek to a lot of you. I'll just bring your attention to a few points. His resting gradient was 14, and he had a Valsalva gradient that went up to over 77. So he was significantly obstructed, and his symptoms got worse when he would bear down or when he would exercise, as his gradient would go up. He started mavacamten, and he went for his monthly REMS program, which is getting the echocardiogram done, evaluate his ejection fraction and his gradient with his HCM Center of Excellence, which I believe is Cleveland. And he was found to have his gradient drop considerably. And as of January 26, 2023, while there still is some left ventricular diastolic dysfunction, meaning the heart is still struggling to relax a bit, his gradient went down to 6 millimeters of mercury, which is basically as close to zero as, we can pretty much get. It's very tiny. And he is back to an active lifestyle and feeling well. And here he is in a picture with his wife, visiting his favorite musician's memorial on Rocky Mountain High, because he's a John Denver fan, but he calls him Johnny. So I guess when you're close, you call him Johnny. So Dennis is doing really well today, and we're happy to share his positive experience on one of our newest medical options in HCM, and that is Camzyos. And we're back on the tour, people. So now I'm going to play a piece from the team at Cytokinetics.
Hypertrophic cardiomyopathy, also known as HCM, is the most common inherited cardiovascular disorder affecting approximately 1 in 500 individuals worldwide.
However, only 1 in 3,200 people in the United States are diagnosed with HCM and experience symptoms.
Cytokinetics is proud to support our advocacy partner, HCM Act, the leading source of HCM information available for patients.
Through our collaboration, we have been able to provide educational programs to provide insight into HCM and to provide support to patients and their caregivers.
At Cytokinetics, patients are our North Star. We build our science around patients and their families through authentic and ongoing engagement, and are committed to transforming patients' lives through our activities.
Today, along with HCMA, we are happy to elevate the patient community through HCM Awareness Day. Yeah!
I give props to the guy who wore the heart outfit. That was adorable. Again, here is a brief break to remind you, if you want to donate to the HCMA, all you need to do is take a picture of your screen right now, and you get the QR code, and that'll take you to the Donate Now button. So please consider donating on HCM Awareness Day. And now from one of our partners, the Wittek Foundation, who I've known Pam for many years now, and we're excited to be partnering with her, some early science research initiatives.
Hi, my name is Pamela Cohen, and I'm the founder and president of the Wittek Research Foundation for Hypertrophic Cardiomyopathy. And I'm very happy to share information about our organization with you on this HCM Awareness Day. The Wittek Foundation was founded at the end of 2020, and we are a 501c3 public foundation. The goals of our foundation are first and foremost, it's to promote research supporting identification and development of new therapies for hypertrophic cardiomyopathy, with the goal of modifying and curing disease. And we plan to do this by funding scientific and clinical research. Second goal would be to set up educational seminars for academic researchers to share new information that's coming out there, both via experts as well as new information that will be generated from the research that we fund. And of course, these seminars will be made available to the public, and we plan on posting these on our website as they come up. Two other goals would be to bring together relevant parties like academic researchers and pharma industry and biotech industry, as well as government regulatory agencies, to sit down together and create policies designed specifically to accelerate development of new HCM treatments. This is something that has been done very, very successfully in other fields, starting off with HIV and now with cancer. And these four groups, and actually I meant to add as well, patient advocacy groups like the HCMA are very much a part of this as well. Because we need these treatments and we need them as quickly as possible. We have patients waiting. And then lastly, of course, we plan to encourage broader HCM disease understanding and treatment to underserved and underrepresented populations. Our accomplishments last year in 2022 were a think tank meeting that we set up in Chicago. We had 40 participants from actually all over the world, experts in HCM. And the goal of the meeting, which I think we achieved, was to identify the highest priority areas for further research and to identify those things that our organization will fund research for in the nearest future. Our plan for this year, 2023, is to begin giving out grants for that research. And of course, to accelerate fundraising to continue to support everything that may be necessary to get those new treatments out there and developed. I want to make the point, which is very important, that I have joined hands with other HCM patient advocacy groups, most importantly, HCMA, Children's Cardiomyopathy Foundation, as well as other groups in the US. And we're starting to reach out as well internationally, because it's a disease that can benefit from conversation across the globe to pool research and understanding. And we all have one goal, which is the improvement of treatment and ultimate cure for HCM. If you want to learn more about our organization, please check out our website. It's www.wittechfoundation.org, and that's WITTEK foundation.org. Thanks a lot again for the opportunity to share this with you.
Thank you, Pam. And now we're off to the Cleveland Clinic, and you're going to hear from Linda Tsai. I'm going to turn off my microphone and camera because I don't need to be here right now. Here we go.
Hello, everybody. I'm Milind Desai, and I'm the director of our Hypertrophic Cardiomyopathy Center here at the Cleveland Clinic. First and foremost, congratulations to all of us, especially the patients, for the HCM awareness and a lot of things that have happened in the last year. I think it is always good to recognize what we've been able to achieve together so that we can do even greater things in the future. I would like to especially say 2022 was a banner year for the disease. No other time in recent memory was the spotlight more bright on hypertrophic cardiomyopathy than it was in 2022. And for good reason, for really good reason. Obviously, I am proud, and on behalf of all my colleagues at the Cleveland Clinic, I'm proud to say that we were in the thick of everything. Not only do we have the most comprehensive clinical program for HCM, that includes all aspects of clinical management, advanced imaging, the best there is, genetic testing, invasive therapies, and now there's a new kid on the block with the emergence of precision medicine. And boy, we were there in the thick of things all year long last year. Obviously, one of the most important things that we were able to do was successfully execute the VALOR HCM trial, despite all the challenges thrown at us by the pandemic. We presented the data twice at American College of Cardiology and American Heart Association, essentially in advanced patients with obstructive hypertrophic cardiomyopathy. To recap, what it showed was it reduces the need for septal reduction therapy at 32 weeks in 88% patients. 100% patients at baseline needed heart surgery or septal reduction therapy. After 32 weeks, 88% patients no longer were eligible or needed, and 95% patients chose to continue on medical therapy. That's big. That's big and potentially a game changer in the field. Now, something else happened in April 2022, and that is mavacamten, the first cardiac myosin inhibitor, was FDA approved. This is the first drug, precision therapy drug, that was approved by the FDA, and that's huge. That was rolled out in the next few months, and we have now started. We have a robust program of how to treat patients with Camzyos, that is the trade name, in addition to all the other things that we will talk about. We also continue to participate in the Sequoia trial, which is testing the next-in-class aficamten, just so that our colleagues our patients with non-obstructive hypertrophic cardiomyopathy don't feel left behind. Just a couple of months ago, we have launched the Odyssey trial. Odyssey trial will test mavacamten and its efficacy in non-obstructive patients. And again, Cleveland Clinic is spearheading the trial. I am the executive study chair, and C5 Research at the Cleveland Clinic is helping execute the study. So a lot of things happening in the context of medical management of hypertrophic cardiomyopathy. Having said that, we are not losing our focus on what has worked over the years, over the decades. Septal reduction therapy. Last year, we presented data, that SPIRIT HCM study, that showed that surgical myectomy done at an expert center like the Cleveland Clinic significantly improves the quality of life in HCM patients. We published this data, but there was also a little bit of word of caution. Just a couple of weeks ago, we published data from a large Medicare registry on hypertrophic cardiomyopathy patients. We wanted to see what is the real lay of the land nationwide in the United States. What we were able to show that there is obviously a direct and inverse correlation between number of cases you do and your outcomes. The more cases you do, the more operations, procedures you do, the better your outcomes are. However, a major word of caution that we noticed was 70% of patients that had an SRT procedure in the last 5 years in the United States were performed in low volume centers. That means a lot of advocacy, a lot of better messaging, and a lot of adherence to guidelines needs to happen. Cannot underscore the importance of that. Cleveland Clinic is working with American College of Cardiology to help develop programs so that we can perform better echocardiograms, better imaging, and we are going to launch this program in the next few months, where across the country, sonographers will be trained to better to obtain more optimal images. Lastly, there's obviously a lot of excitement about this. A new society has been formed dealing only with hypertrophic cardiomyopathy. Something new on the horizon is gene therapy. We are launching studies, early phase studies, testing the efficacy of gene therapy in hypertrophic cardiomyopathy. This is potentially going to be a game changer in the future. So more to come in the next few years. So to summarize, on a personal level, this has been an extremely exhilarating journey in 2022 as it relates to hypertrophic cardiomyopathy. Boy, a lot of stuff has happened, but I strongly believe we are still getting started, and I sincerely thank Lisa, HCMA, and her staff for being at the forefront of helping patients and being effective advocates. We are getting started, and I congratulate everybody on where we have come so far. Thank you so much.
Good morning. My name is Timothy Wong, and I'm a cardiologist that directs the UPMC Hypertrophic Cardiomyopathy Center. I'd like to thank the Hypertrophic Cardiomyopathy Association and Lisa Salberg for this opportunity to share a little bit about our program with the community. We've been a center of excellence since 2014, and we hope to continue the collaboration moving forward.
Hi, I'm Janice Green. I'm the primary nurse practitioner at the UPMC Hypertrophic Cardiomyopathy Center. Our goal at our center is to create a medical home for our patients. To better describe our center, I think it would be helpful to first talk about the key players that provide care to our patients. First of all, we have Kim Castro. She's our main nurse who helps to work with schedulers to get our patients scheduled for their first new patient visit. She will help coordinate their scheduling along with getting any necessary testing needed for their visit. Additionally, she will also work to obtain any medical records that we may need to help provide a comprehensive visit. Our visit often starts with meeting with our genetic counselors, Vicki Bacon and Meredith Jones. They will first go in and speak to our patients and obtain a comprehensive family history and then also provide genetic counseling. Next, Dr. Wong and I will go in and discuss the diagnosis with our patients. We will also discuss our treatment plans, review risk stratification, and then also provide education on how our patients can live with this diagnosis. If our patients need a specialty referral, then we will work with our electrophysiology teams, pediatric cardiology, and also our interventional cardiologists that have an interest in hypertrophic cardiomyopathy. We take pride in providing our patients with as much information as they need to live with this diagnosis. We will summarize this in a comprehensive after-visit summary where we review the key concepts that we have discussed with our patients during their visit so that they may take it home, they can review it as needed, and then also review it with their family members. Our goal is for our patients and their family to be on the same page at the end of their visit. Additionally, we also take pride in being able to be available to our patients either through telephone calls or through the patient portal should they have any questions in between visits. We'll also review any test results that may occur in between office visits with us. It's amazing how much time we spend talking to our patients and communicating in between their visits with us. Next, Dr. Wong will discuss further information about our program.
So I think our center has three main goals relevant to the hypertrophic cardiomyopathy space. As Janice mentioned, we really want to provide outstanding patient care, and we have some specific services that I think are a little bit more unique to our center beyond what the guidelines typically focus on. We have a large interest in following our patients and providing counseling to them before, during, and after pregnancy. And I'm actually on staff at McGee Women's Hospital where I can follow our patients during pregnancy and at the time of delivery. We also enjoy doing outreach into the community. We have a large Amish population that has trouble with access, and we have a focus on doing outreach and screening events and bringing care to patients in the community. Second, we have an active research program. I have been funded in the past by the American Heart Association for cardiac MRI imaging research, and we have an exciting new project in collaboration with Dr. Howdy Wu, where we're better understanding what variants of uncertain significance mean in select patients by generating pluripotent stem cells based on their genetics. Finally, we really want to help educate both patients, their families, as well as the medical community about some of the unique aspects of HCM. And both Janice and I actively participate in local and national meetings where we can collaborate with the entire community. So I'd like to thank Lisa and the HCM again for this opportunity. The final thing I'd like to share is that we expect a new heart hospital in the next coming few years. So if you hear some jackhammers behind the audio of this message, it is going to eventually lead to a 14-story brand new hospital. On that note, hope to meet some of you at upcoming meetings, and thanks again.
Ladies and gentlemen, I have late breaking news. I'm even going to stop the screen share for just a moment here. Late breaking news in from the state of Massachusetts and the state of South Dakota. Both have passed resolutions today acknowledging HCM Awareness Day. So our thanks to the state of Massachusetts and the state of South Dakota. We do have some troubling news from Michigan and Minnesota. Their state houses are shut down due to severe weather. So we're not sure if we're going to get to the end today. So we just want to acknowledge and thank those individuals for their participation. And specifically in the state of Massachusetts, a big shout out to Dr. Ethan Rowan, who was our in-state sponsor of HCM Awareness Days. So Ethan, thank you. Yeah, brought it home for us. I see a couple of questions have populated, and for some reason, my ability to type answers while videos are going is not quite working normally today. So I'm going to do a quick break here and answer some of your questions. What states has the HCM Act been approved in? I think, answer this earlier. New Jersey and New York have incorporated aspects of the HCM Act prior to us naming it the HCM, Healthy Cardiac Monitoring Act. So those are the two states, and I'm going to cancel that one now. And Anonymous, you stated that your sister was diagnosed at 41 and had an ablation. I'm not sure if you're referring to an alcohol septal ablation or a radiofrequency ablation for arrhythmia. Her children were young adults and they were tested by ultrasounds and didn't have HCM, but this was 2005. So the guidelines for screening in an HCM family are every 3 to 5 years in adulthood. We do not stop with one screening. So your sister's children should go back and get screened because it has been way too long and something could be going on in there. And that is what you need to do. And you can find screening guidelines on the HCMA website. And those guidelines were endorsed by the American Heart Association, the American College of Cardiology in the last consensus document or guidelines document. So that was answered live. And Ross has a question. I don't know why this is going to Ross. Are the different molecule new drug testing on patients with different genetic ancestries, race as a social construct of biology? How do we categorize traditionally underrepresented patients in clinical trials? So Valerie, I'm going to take that question and I'm going to tell you that we know that in HCM and in pretty much every disease state, there is a lack of ethnic diversity in clinical trials. We are making a concerted effort to ensure that all ethnicities, genders, and ages are included in clinical trials in the future. I'm happy to say that we're talking about a pediatric trial coming up in the next year or so, and that we have a project that we're going to be seeking funding for called the All Hearts Collaborative that will help to raise awareness of not only HCM, but some other diseases that can fall into the HCM spectrum of disorders, amyloidosis, and uncontrolled hypertension. And we're going to be doing outreach into traditionally Black and Brown communities to ensure that they have the information that they need to make good choices for getting cardiac care, and then hopefully participating in clinical trials. So we do feel this is critically important to the future, and hopefully we'll be hearing some more soon on those initiatives. So now we're going to go over back to my slides, and I answered that live. Let me clear that out. And we're going to hear from Dr. David Fuhrman from Corewell Health, which is going to be a new name for me to get used to. It used to be Spectrum Health in Grand Rapids, Michigan. So let's get back to the program.
Hello, I'm Dr. David Furman, the Medical Director for the Hypertrophic Cardiomyopathy Program at Corewell Health, which is the new name for Spectrum Health in Grand Rapids, Michigan. We want to thank you for the opportunity to participate in HCMA Awareness Day. It is my pleasure to share some highlights about our program and introduce our awesome team. Our clinic was founded in 2013 and became an HCMA Center of Excellence in 2017. We were the last stop for Lisa Sahlberg prior to her heart transplant, so she likes to say we broke her heart. We offer a comprehensive, patient-centered approach to diagnosis, education, and treatment. We bring our resources around our patients wherever possible, which includes coordinating consultations in our HCM clinic with an electrophysiologist, genetic counselor, pharmacist, and social worker as needed. We facilitate family screening of our HCM patients along with our pediatric cardiology clinic. Our echocardiography lab offers multiple regional locations to allow patients to remain in their community for much of their testing. Our approach has also evolved during the COVID-19 pandemic to include virtual provider visits and genetic counseling. Our more advanced services include cardiac MRI, catheterization, and electrophysiology labs, all available at Meyer Heart Center. Our multidisciplinary team includes 3 physicians, myself, Dr. Jeff Decker, and Dr. Richard McNamara. We work alongside physician assistant Lori Singer-Schiraldi and our nurses Sue Philpott and Paula Drosty. Electrophysiologists Dr. Alfred Albano and Dr. Najib Shalfoun, cardiac surgeon Dr. Tomas Timic, pediatric cardiologist Dr. Stanley Sidor, genetic counselor Bethany Grisco, and social workers Doreen McGrath and Justin Joseph round out our team. Our clinic follows 939 HCM patients, and in 2022 we saw 155 new patients. Dr. Timic performed 14 septal myectomies last year. One of these patients, a 32-year-old male, had a septal myectomy and a mitral valve mobilization. He's doing fantastic, the best he's ever felt. He's walking several miles and even running with his children. Perhaps the most exciting development for our patients was our involvement in the groundbreaking clinical trials for mavacamten, including Explorer HCM, MAVA LTE, and Valor HCM, in which several of our patients were enrolled. Now that mavacamten, or Camzyos, is FDA approved, we have several patients whose quality of life has been dramatically improved by this first-of-its-kind medication. We are continuing our involvement in clinical trials of both mavacamten and aficamten for patients with both obstructive and non-obstructive HCM. One of our favorite patient stories is a patient we followed for many years with obstructive HCM. She was an avid traveler and even climbed the steps of Machu Picchu and hiked in Sicily. After a Caribbean cruise, she began to not feel well with an increase in shortness of breath. With worsening symptoms, her active lifestyle was quickly curtailed. She entered the Valor HCM trial in November of 2020. She is now feeling fantastic and has been willing to share her experience with other patients. Referrals to the clinic can be faxed to 616-885-5411 or by calling the office at 616-885-5000 and asking for one of the HCM nurses. It has been a pleasure to collaborate with the HCMA over the years, working together to improve the quality of life for hypertrophic cardiomyopathy patients. Thank you.
Okay, so David had to go and bring up the ever famous trip to Grand Rapids, which my trip home, I went 2 days later to the hospital to be admitted, and I found out I needed my transplant pretty quickly thereafter. So I do tease them that they broke me, but They also help fix me back up again because they gave me a reason to keep living. So thanks, David. We have another question popping in here, and I'm just going to jump in and answer real quick. People are talking about genetic testing, and they were tested in 2018 and no gene was identified. But the rest of the family hasn't been evaluated since then. A no gene found genetic test does not mean that you do not have hypertrophic cardiomyopathy, and it does not mean that your family members are not at risk. It means that we just don't know enough yet, and we're still learning about all the different genes. So you should have been counseled that the genetic test doesn't have a lot of value for your family, and clinical screening should continue. So for young ones under 25, we're going to screen them every year with an echo, EKG, and checkup with cardiologist who knows about HCM. And for adults, you're going to go every 3 to 5 years for follow-up screening, or if a symptom comes up, if they start to feel palpitations, if a murmur is presented, if they lose consciousness, if they start to feel fatigued for no reason, these are triggers to send them back to the cardiologist just to make sure everything's still okay. So TT, I hope that information was helpful. Now back to the program. And I'm going to I lied. I'm back. Sorry, I lost my cadence there. We're going to share another HCM warrior story. They're each a little different today. Today, we're going to talk about Michael Sinclair. His sister is an active member of our HCMA's Patient Education Committee, and I thought it would be important to share his story today, leaning in a little bit to what one of the previous questions was about health equity. So Michael, as you can see, is an African-American male. In 2018, he had some chest pains that led him to an emergency department, and they didn't identify any cardiac issues, and they sent him home. In 2019, he passed out after playing basketball and was diagnosed at the ripe old age of 30 with hypertrophic cardiomyopathy. He was treated by a community cardiologist, but he lost insurance coverage and stopped managing his HCM. He had 4 children, and he was more focused on their needs than his own, I suspect. On November 9th, 2021, he suffered a sudden cardiac arrest while playing a pickup game of basketball. He died as a result of that arrest. And his sister wants people to know that HCM is something you need to take seriously. And you need to discuss it throughout the family and ensure that you get high quality HCMA recognized Center of Excellence care if possible. So we really applaud his sister in her willingness to be part of our community and share his story, and also help to develop better education models that will go out to all communities. So thank you, Lakeisha, for your involvement, and God bless Michael. Next, we're going to hear from a partner that you may not have heard of before. It's a company called BioMarin, and they too are working on genetic therapies. Let's hear from BioMarin. And I'm going to turn this off.
Hi, my name is Bethany Ferrum, and I work in Global Patient Affairs at BioMarin. And on behalf of all of us here, we want to wish you a very happy HCM Awareness Day. We would like to congratulate HCMA for more than 25 years of service, supporting research and providing the community with valuable resources to help educate and support those living with HCM. This past year, BioMarin has initiated outreach to patients, clinicians, and advocates for HCM. We were honored to partner with HCMA to support their Genetics Special Edition Big Hearted Warriors webinar. Through this multi-center educational effort, HCMA provided a forum for experts and advocates to engage in meaningful conversations about why genetics are important, and resources for families to learn more about their own condition. We look forward to supporting more HCM educational efforts for the community with HCMA in 2023.
Hi, my name is John Kaltman, and I work in Global Clinical Development at BioMarin. I'd like to take this opportunity to inform you about BioMarin's 2023 plans regarding hypertrophic cardiomyopathy. BioMarin will continue our research into an investigational gene therapy for hypertrophic cardiomyopathy caused by the most common culprit gene, MYBPC3. We are working hard to generate the data necessary to support an investigational new drug application to the FDA, which, if approved, would allow first-in-human dosing as part of a clinical trial. Looking ahead, we're excited to continue to learn from HCMA and its community about the patient experience and to include you as partners in key drug development meetings and decisions. We're looking forward to partnership with the hypertrophic cardiomyopathy patient community in 2023 and beyond. Next is a video about who we are and what we believe in here at BioMarin.
From the very beginning, I wanted to do research and find cures and therapeutics that could really change people's lives.
Transformational is always forefront. Someday you're going to tell your grandkids that this is what you were working on.
Over the 25 years since the founding of BioMarin, there has been a transformation in our understanding of how genetic variation underlies human biology. We're uniquely positioned at BioMarin to capitalize on that remarkable transformation of the field of genetics because we have been doing genetic medicine longer than anybody else.
We're building upon what we learned to have even greater impact to bigger patient populations.
I love the compelling reason that we come to work every day. We have huge connection to our patients. The process and the samples and the results, all of those things are critically important, but it's how we deliver that.
Our team is working on gene therapy. We are focusing on identifying more molecular targets using translational genomics and molecular genetics.
And we're not limiting ourselves to one modality.
There are still many, many more opportunities to make big differences in people's lives. We think about how to take what we've done and what we're good at and help even more people.
It's about trying to transform patients' lives. Working on only drugs that we think will have a huge effect on patients.
You see people who are suffering, you want to transform as many lives as you can.
It's a change in their quality of life. It's the ability to walk when they could never walk before, or to be able to go to school when they couldn't do that.
We're always challenging our assumptions to think, what more can we do for our patients? There's always more that can be done, and we need to think that way.
When you see the patients and how these transformational modalities really do improve their lives, that's what's most rewarding for all of us.
We're one of the original genetic medicines companies, and we have been incredibly successful in doing it.
Patients are waiting for us.
Now I know that there's hope, because I know in that building, there's people that want to make our lives better, and that's a gift.
Happy HCM Awareness Day from the Partnership to Advance Cardiovascular Health. We're happy to partner with HCMA to weigh in on public policy issues affecting patient access to life-saving treatments. Together with HCMA, we've created a number of educational materials highlighting the importance of new and innovative treatments, and every day we're advocating on a state level and at the federal level for patients living with HCM. We look forward to continuing our partnership with HCMA while we work to address barriers impacting optimal patient care. Hope everyone has a great day.
American Heart Association guidelines for treatment of HCM stress the importance of a multidisciplinary team, and we're proud to provide multidisciplinary care for our HCM patients here at Yale. Our care starts with diagnosis with experts in clinical imaging as well as genetics. Once a diagnosis is established, we focus on treatment of symptoms with up-to-date therapies, including our myosin inhibitor program, which Dr. Sekand will be talking about, as well as myectomy surgery if needed. We then turn attention to assessment of risk for sudden cardiac death with our electrophysiologists. We also provide AF treatments, including ablation through our atrial fibrillation center. Helping our patients live a full life with HCM is critical. We focus on exercise, psychosocial aspects, and have a cardio-obstetrics expert at our center to help hypertrophic cardiomyopathy patients build a family.
I want to thank the Hypertrophic Cardiomyopathy Association for giving me the opportunity to highlight an important advance in medical therapy now being offered to our patients. The Yale program has been a proud and active participant for many years in clinical research that has led to the development of novel medical therapies for HCM. This has included a new class of medications called the cardiac myosin inhibitors, which are a novel therapy developed to target heart muscle abnormalities which drive symptoms related to hypertrophic obstructive cardiomyopathy. Newer data has also suggested that patients may be able to avoid invasive procedures that previously were used to treat this condition. At Yale, we have a comprehensive team of physician and imaging specialists, nurses, advanced practicing providers, and pharmacists who work with our patients, insurance companies, and pharmacies to ensure that this new medication is administered in a safe, monitored, and cost-effective manner. It is our goal to improve quality of life for our patients while streamlining the complicated process of starting a new medication.
One aspect that makes the Yale program special is its commitment to both clinical and translational research. Yale is a center for multiple active clinical trials of myosin inhibitor therapies, a treatment that is changing lives and revolutionizing how we manage the obstructive HCM. In addition to this, we have an upcoming trial examining the effects of these therapies in non-obstructive HCM. As part of the Sarcomeric Human Cardiomyopathy, or SHARE consortium, we're also participating in multiple ongoing research projects. In addition to this work, we also have an active program in translational science to study the molecular characteristics and performance of heart muscle in HCM patients. Together, our commitment to research not only helps our patients gain access to cutting-edge therapies, but also advances our understanding of the disease and helps us to provide more effective care.
At Yale, we have numerous patients with HCM undergoing transplant each year, and they all do very well. As part of our routine care, we ensure that we're being very mindful of the hallmarks of more advanced disease so that we can act early. In terms of transplant, we ensure that our patients have access to all the newer and contemporary mechanisms to expand the donor pool, including donation after circulatory death or DCD transplants, as well as utilization of organ care systems.
Again, my reminder that it is HCM Awareness Day, and your donations would be incredibly helpful today to help us in our mission in the future. Last year, I forgot to put these slides in, and this year we made sure we put a few of them in so you don't miss an opportunity to help give to the HCMA. And if you're not somebody who has the financial resources to give, you can also become a volunteer for the HCMA and help us in our cause that way, or look for your unique way that you can help raise awareness or support the organization. I'll bring to your attention, here I will come off camera, my beautiful earrings that I'm wearing today. These are created by a lovely young lady from our community, and through the month of February, she was donating proceeds, or part of her proceeds, to the HCMA. Every dime helps. We've lost a revenue source. It wasn't a very big one, but it was Amazon Smiles program was disbanded, actually is disbanded the end of this month. They gave us a whole whopping 30 days notice, and Amazon in its infinite wisdom decided that it didn't want to support small nonprofits any longer after 10 years of us offering support and building their actual platform. And now your proceeds and your purchases will no longer go to your chosen charity, which is highly disappointing. So we lost one revenue source. We'd like to create some new ones so we can supplement what they took away from us after 10 years of helping them build a platform. Am I bitter? Maybe just a little. Thanks, Bezos. Anyway, back to the show. Next, we're going to hear from Duke University.
Hello, I'm Andrew Wong, and I'm a professor of medicine at Duke University Hospital in Durham, North Carolina. I direct our hypertrophic cardiomyopathy program, and I'm very glad to present an update about our program to the HCM Patient Awareness Day sponsored by the HCM Association. 2022 was our first full year in a new clinic location, which is a large multi-specialty building between Durham and Raleigh, centrally located. And we have a full cardiology practice there, including hypertrophic cardiomyopathy clinic. We see valvular heart diseases there, coronary artery disease, preventive cardiology, and electrophysiology. Our hypertrophic cardiomyopathy clinic is on Mondays. That's staffed by me as well as a genetic counselor. And we have capability of doing on-site echocardiograms, stress echocardiograms, cardiopulmonary exercise testing, as well as coronary CT scans. 2022 was obviously the first year where we had the availability of a cardiac myosin inhibitor as an approved therapy for patients with obstructive hypertrophic cardiomyopathy. And we do see a lot of interest in our patients in being considered for this, as well as referrals to initiate patients on this novel treatment. I would say that our process has been fairly smooth with the help of a pharmacy technician and our nurse clinician to manage patients as part of the REMS program for Camzyos. We continue to participate in multiple clinical trials of novel therapies for patients with symptomatic hypertrophic cardiomyopathy, both those with left ventricular outflow tract obstruction, but also non-obstructive hypertrophic cardiomyopathy. Our interventional program remains strong. I think we have increased the number of patients who are being treated with septal reduction therapies in the last year with very good outcomes. In terms of what we're looking forward to in 2023, I would say that we are looking forward to ongoing participation in clinical trials. We are participating enthusiastically in the Hypertrophic Cardiomyopathy Society of medical experts in the field and hope to see greater initiatives in terms of education and program development from the HCM Society as well. If you have any questions, please feel free to reach out to me. I look forward to learning more about other programs as part of this Awareness Day. Thank you.
Off to Northwestern.
Hello, everyone, and welcome to HCM Awareness Day. I am talking to you from the HCM Clinic of Northwestern. I'm Dr. Lubna Chowdhury, and I will tell you a little bit about our HCM program. It was established in 2008 with the goal of providing specialized, comprehensive state-of-the-art care to patients and families with hypertrophic cardiomyopathy in participation with the HCM Association. HCM is a very complex disease that requires multidisciplinary care, and we collaborate with a number of departments within our hospital to provide that care to our patients. This is an overview of the clinic. We see all sorts of patients with HCM. We are here to, first of all, confirm your diagnosis, test you with targeted testing, talk about risk stratification for all patients, genetic counseling, genetic testing, and we really treat you according to your needs. No two patients with HCM are quite alike, so each patient requires individualized treatment, and we really specialize in that. We have a diverse array of treatments available to you, both through medicines and through invasive therapies that are listed here. And we really believe in a tailored approach and shared decision-making with our patients. We refer all our patients to the HCMA website, and our clinic serves as the center for coordinating these testing and treatment approaches according to the patient's needs. We are a very busy clinic. We see several new patients a month with hypertrophic cardiomyopathy and several more HCM patients for their follow-up appointments. Now, Northwestern has created affiliations with several suburban medical centers, and they keep adding to the list of hospitals which are under the umbrella of Northwestern. So it serves two purposes. We get more patients from these centers referred to us to the downtown HCM clinic. We will be providing an HCM clinic in one of these suburban centers with a physician who is now training with me as I speak. However, that more to come on that later, perhaps next year. But these centers enable our patients who are on Camzyos or mavacamten to have their monitoring echocardiograms done close to their homes. And I can see those echoes and then advise as to their next dosing. Now, if you are told that I do not have any appointments for a long time, it's very likely that we can accommodate you in one of the many extra office hours that I do. Therefore, you can request the patient access representatives at the scheduling desk to send a request to my administrator so she can work on accommodating you earlier. She keeps a running list of people who need to see me, who are waiting to see me, and we slot them into these extra clinics. Where do our patients come from? All over, really. They come from my colleagues at the Bloom Cardiovascular Institute of Northwestern, the Northwestern Medical Group physicians all across our satellite hospitals, regional cardiologists in different states. The HCMA refers us patients who contact them. Other institutions, when patients move to Chicago, they get our name and they come to see us. They look us up sometimes. And of course, family members refer patients to come here. These are a spectrum of the invasive therapies we offer to our HCM patients at Northwestern. So you can see that you can have surgery, alcohol septal ablation, arrhythmia management, arrhythmia ablations, defibrillator implantations, and as well as, doing heart transplantation in the patients most refractory to all treatments that we try. This is the core HCM staff at Northwestern. So there's myself, and I'm joined in this endeavor by Dr. Dominic Fullenkamp, who will also be seeing you as a new patient in hypertrophic cardiomyopathy. So if you're referred to the Northwestern HCM clinic, you may be seeing Dr. Fullenkamp or me. Dr. Robert Bono also sees some patients, but not very many at the moment. HCM genetics experts are Dr. McNally and Dr. Wilsbacher, and I sometimes refer you to them when we get back a lot of genetic details that we are not experts on, but they are. And we have Lisa Castillo as our genetics counselor, who can often do a telehealth visit with you and order your genetic testing. Kayla Mueller is my nurse, who you will be in contact with very often. Brittany French is my advanced practice nurse, as well as Mary Coletta, whom we have also trained to do this. We also are affiliated with the Lurie Children's Hospital of Northwestern, and the cardiologists there are listed here, and their patients, often when they reach adulthood, come and see me in the HCM clinic at Northwestern. So Joan Draves is our administrative lead, and my administrators are about to change as I speak. So Maria Fernandez will be my new administrator, changing over from Abigail, who has served me until now. Here is listed our clinic number, and you can call this clinic number and schedule appointments to see us. This is a picture of all the surgeons that we have at Northwestern doing surgery for HCM patients. The main two are here, Dr. Doug Johnston, who joined us recently. He's a world-renowned surgeon, and he has a special interest in HCM surgery, so we're thrilled to have him join us. And we also have Chris Mehta, who's been doing HCM surgeries for some time. Dr. Patrick McCarthy used to do most of these surgeries. He's pulling back a little bit on that. These other surgeons are excellent surgeons who have done HCM surgeries for us, including transplants and unroofing of the LAD in an HCM patient, so on and so forth, specialized surgeries. So we are all happy to have them collaborate in the care of our patients. This is a picture of the electrophysiology group of physicians at Northwestern who see my patients. I send patients to all of them, and they're all experts at arrhythmia management, implantation of defibrillators, and so on. This is Dr. Jim Flaherty, who does my alcohol septal ablations, and he's an expert in that. And he also does concomitant stenting of a coronary artery if needed, and so on. These are an update of the clinical trials that are going on in hypertrophic cardiomyopathy at Northwestern. You can see some of these trials have been completed already, but I want to really draw your attention to the Sequoia HCM study. And I really want to see more of you enroll in this study, because this is a very important study evaluating aficamten for the treatment of obstructive hypertrophic cardiomyopathy. It's a cousin of mavacamten. It's a similar drug, but it's a second generation myosin inhibitor. And we really want to see symptomatic obstructive HCM patients before they're even on any treatment to just come to us and talk about this trial, because it's only 6 months. So if you're not too symptomatic, you can be on this study, and it's a placebo-controlled study. So you have a 50% chance of being on the real drug versus not. But if you're not too symptomatic, then it may be a good option for you, and it would give us a wealth of information. So that's a plug for the Sequoia HCM trial that we are pushing for. IMBRIA, the Improve HCM study, is still recruiting for non-obstructive HCM patients who have symptoms, and we hope to wrap up recruitment, as I understand, by April. So you have a little window to join this study if you wish, if you have non-obstructive HCM. So this is the number of our clinic at Northwestern. I want you to make note of that, and thank you for your attention.
Hi, I'm Faraz Ali, and I'm the CEO at Tenaya Therapeutics. Thank you for making time to learn more about us and about our science. Working with leading patient organizations like the HCMA is critical to our mission, as important as all the science that we do here at Tenaya. For patients and families, we know that the status quo is simply not good enough. We know that you're watching and waiting, and we know that we can do better. And here at Tenaya Therapeutics, we are determined not to fail you. There are a few important things to know about our approach. One is that we at Tenaya are exclusively focused on developing new medicines for heart disease. Heart disease is all that we do. We are taking advantage of the huge strides that have been made in human genetics. We can now better understand the connections between genetics and heart disease. And we can use those insights and apply them to develop novel medicines that address the underlying genetic cause of different forms of heart disease. Where patients have inherited a genetic mutation that is causing their hearts to fail, we aim to replace or even fix that underlying genetic defect. And where patients have lost cells due to disease or injury, we aim to regenerate new cells to replace the ones that have been lost. Now, some of this has never been done before. And so over the last several years, we have invested in the science and the capabilities that allow us to do the necessary innovation and to achieve these breakthroughs. Now, as you may know, MYBPC3 mutations are the most common cause of HCM. And our lead program, called TN201, is aimed at treating any form of HCM where a MYBPC3 gene mutation is thought to be the underlying cause, whether it is obstructive or non-obstructive, and whether it's affecting a child, an adolescent, or an adult. This TN201 investigational treatment is intended to stop the progression of MYBPC3 associated HCM and all the symptoms associated with it after a single dose. In the following video, you'll learn more about our approach towards gene therapy for the heart, and more specifically about TN201.
Tenaya is shaping the future of heart disease treatment through a bold mission: to develop therapies that address the underlying causes of heart diseases and conditions. Tenaya is addressing many heart conditions affecting both children and adults, utilizing genetics to discover and develop small molecule and gene therapy medicines for both rare and prevalent heart conditions. In gene therapy, Tenaya's approach is designed specifically for the heart and involves delivery of a working gene with AAV9. AAV, or adeno-associated virus, is the leading vector for delivering genetic medicines. AAV is naturally occurring and has not been found to cause disease in humans. With this approach, viral DNA is removed and replaced by the gene of interest and elements that direct the therapy to target cells. A one-time intravenous infusion delivers a working copy of the gene. This provides the code to produce functional protein and correct the underlying genetic cause of disease. Tenaya's initial focus is on addressing the leading genetic cause of hypertrophic cardiomyopathy due to pathogenic variants in the MYBPC3 gene, as well as the leading genetic cause of arrhythmogenic right ventricular cardiomyopathy due to variants in the PKP2 gene. We will not stop until we have helped every person with heart disease reach their own peak. Contact us to learn more about our gene therapy programs or to participate in an ongoing observational study.
Hello. For those of you who don't know me, I'm Wendy Borsari, and I'm proud to be a part of the patient advocacy team at Tenaya Therapeutics. As a patient living with HCM myself and the mother of 2 affected children, I know firsthand the challenges HCM presents to patients and families every day. And I'm committed to working with our community to help bring new solutions to life. Since 2013, I've been working alongside industry, advocates, and leading physicians to advance the treatments of HCM. And it's been thrilling to witness firsthand the strides being made to understand the condition and improve the lives of people living with HCM. Tenaya is committed to discovering and developing medicines that go beyond simply treating symptoms and address the root causes of diseases of the heart. Genetic medicines like gene therapy for MYBPC3 associated HCM are becoming a reality. And Tenaya is at the forefront of bringing these potentially life-changing treatments to patients. Patients are why we do what we do at Tenaya. If you'd ever like to learn more about our efforts, I encourage you to reach out to me directly at patient.advocacy@tenayathera.com. There are so many ways to get involved, whether it's participating in a clinical trial or natural history study, learning about genetic testing, or contributing to our knowledge of life with HCM. I encourage you to reach out. Happy HCM Awareness Day, everyone, from all of us at Tenaya. Thank you.
I think I'm going to take a moment here to pause because we heard from 2 amazing companies that may not be common names that you're familiar with here in the HCM community. We just heard from Tenaya Therapeutics, and prior to that, we heard from BioMarin, 2 companies looking at a similar target with slightly different approaches. When I learned how close we were to genetic therapies just about 1.5 years ago, I was stunned myself. And coming from a myosin binding protein C family, like they were discussing today, this is the target gene. This is a phenomenal time in discovery for HCM. And I think we all just need to take a second here, take a breath and go, wow, where are we going? There's so many exciting things happening. And this is why it's so critically important that we as a community come together, get programs that are well organized and well executed for the community to help educate people on how to make decisions about participation in clinical trials. It's going to be a highlight tonight. We're going to talk about a number of different clinical trials this evening. So we encourage you to come back and join us for the evening session and just take a moment to say, wow, look how far we've come. Couple of comments or questions in the box here. Lakeisha, I'm so happy you were here to see Michael's story live. Thank you for sharing your brother with us. We do appreciate you for sharing that and for getting involved. So you missed a couple of the speakers. It's going to be available for view later on YouTube. We're actually streaming on YouTube today. It's the first time we've done that since our PFDD. So you'll be able to catch the full event later on YouTube. So go back and watch it as much as you'd like. It'll be there for you. Okay, back to the program. Hold, I almost forgot to share the screen again. Okay, this is cute because Neil looks like he's got a little bit of a red nose going on there, but it's just the start button. Let's hear from the Global Heart Hub.
Hello and happy HCM Awareness Day. I'm Neil Johnson from the Global Heart Hub, and we're delighted to be partnering with HCMA to raise awareness and to support the patient voice in cardiomyopathy. As an international alliance of heart patient organizations, disease awareness raising is a key part of everything we do. Founded just over a year ago, the Global Heart Hub's Cardiomyopathy Patient Council is an alliance of 17 cardiomyopathy-focused patient organizations, just like HCMA, spread across 11 countries. This group now meets regularly to collaborate on activities that will raise awareness of cardiomyopathy and highlight the key challenges from a patient perspective. We're absolutely thrilled to have HCMA as an affiliate of the Global Heart Hub Patient Council, and we're delighted to support and collaborate with Lisa and Elena. Last year, with HCMA's support, our Cardiomyopathy Patient Council ran a first ever international awareness campaign on cardiomyopathy, which delivered over 6.5 million opportunities to see our campaign messages across social and digital channels in 9 countries. Our Patient Council also developed guiding principles for patient involvement and engagement in cardiomyopathy research. 6 simple research principles endorsed by our 17 cardiomyopathy patient associations, advocating for a patient perspective at every step of the research process. In June of this year, our international cardiomyopathy awareness campaign will focus on genetics and the importance of genetic testing in cardiomyopathy. And once again, we look forward to working with HCMA and all our other affiliates in this campaign. So for now, have a great HCM Awareness Day.
So we've got another patient story coming up, and some of them were featured in last year's HCM Awareness campaign through the month of February, and some are new for this year. V we shared last year, and actually American Heart also partnered on his story, but we don't have that one here today. Part of the reason I opted to choose V's story again is because it's quite unique, and he's quite unique. At the age of 15, while living in Vietnam, a murmur was detected. And in his community, that referral to cardiology took less than 24 hours until he had an echocardiogram, and his diagnosis of HCM was complete. He later left Vietnam to come to America for education, and he had a fainting episode when he was 20 years old. And at that time, the implantable defibrillator was implanted. In 2015, he needed surgery for his obstruction, and he had a myectomy. So what does life with HCM mean? Is he, just struggling to get by every day? No, V is thriving, and he is an intelligent and active individual, so much so that he has worked in the research laboratories of HCMA recognized centers of excellence in Michigan, and he's been conducting research while pursuing his PhD. I fully intend on a future where V Tang has a place in the HCM community as a researcher and as a leader in the future. So V, keep on going and doing what you're doing, and thank you for sharing your HCM story with us. Next, we're going to hear from Oregon Health Science, and I'm going to disappear for a second.
Hello, everyone. My name is Ahmed Masri, and I'm the director of the Hypertrophic Cardiomyopathy Center at the Oregon Health and Science University in Portland, Oregon. As many of you are aware, we are an HCMA Center of Excellence. I want to take this opportunity to thank the HCMA, Lisa Sahlberg, and her team for dedicating all their time to furthering the care of patients with HCM and raising awareness for HCM. This is also a good time to share with you some updates about our program. First, I want to remind you that while sometimes we view physicians as the face of some of these programs, really there is a very complex, large, multidisciplinary team that is taking care of you day in, day out, and some of them work in the shadows, others you get to meet and talk to. And I wanted to give you some clinical updates. First of all, that to remind you that we do have a dedicated HCM clinic that runs on Tuesday and Wednesday of almost every week. And some of you met myself as well as some of my colleagues. Ms. Kelly Graham, who's a nurse practitioner, spent many years taking care of patients with HCM, both on the research and the clinical side, as well as I'm happy to announce that Dr. Ben Levin, who is an experienced cardiologist and a cardiac MRI specialist, has joined us from the University of Illinois in Chicago. And many of you will get to meet him over the next couple of months and year. We also have a dedicated cardiac genetic counselor, Miss Erica Jackson, who runs a dedicated clinic as part of our program and offers many days during the week for in-person as well as virtual visits to provide the best care possible to you and your family members. Our program continues to deliver all pathways of treatment for hypertrophic cardiomyopathy, from first-line medications to more specialized care such as septal myectomy. Dr. Howard Song is our myectomy surgeon who's experienced and spent many years performing septal myectomy in Portland, as well as serving the Pacific Northwest community. Also, we do alcohol septal ablation when appropriate. Dr. Joaquin Seguroa helps us achieve excellent outcomes with this procedure as well. And we do perform complex electrophysiological interventions as well as transplant when and if needed. We also have a long history really utilizing novel therapies such as mavacamten. Initially on the research side, many of you have participated in this trial, and thanks to you, these trials have been successful, providing a new treatment options for patients with HCM, obstructive HCM at this point in time. And mavacamten, as many of you are aware, is commercially available at this point. And we have our dedicated pharmacist, Dr. Hongye Chen, who helps us deliver the best care possible to you, our patients, by ensuring that we can secure mavacamten for you, as well as a smooth sailing in this complicated process. It's always a complicated process when it comes to specialty medications. And you also interact with our fantastic program coordinator, Ms. Tanya Davlon, who spends a lot of her time ensuring that you have a really good experience when you visit us, as well as if there are other imaging tests, as well as other appointments that need to be lined up for you, we try to have that itinerary for you so that we minimize the number of trips you come to the site with. And then finally, our fantastic nurse coordinator and manager, Katie Fisher, who spends most of her time taking care of patients with HCM and their families, and many of you have met her throughout the years. On the research side, many things are happening, and many of you are aware of our dedication to furthering the care of patients with HCM. That happens through generating more evidence and studying the disease process, as well as studying the new therapeutics that are coming down the pipeline in this space. Hundreds of you have already participated in our tissue, blood, and urine biobank and registry. And thanks to you, many studies are now being conducted that would help us understand the natural history of the disease, why and how when this disease happens, the severity of it, and why some people develop it while others don't, even though they might have predisposition for the disease. We also continue to do imaging research with echocardiography, cardiac MRI, and our newly acquired PET MR machine, where we are combining both MRI as well as nuclear techniques to study disease processes at a deeper molecular level. We are very active, and that's primarily really, truly thanks to you, our patients, who devote their time and effort in participating in clinical trials. Over the years, our program has grown tremendously, and with that, we also have grown in our commitment to improving delivery of different therapeutics under investigation to patients with HCM. That started many years ago with mavacamten, and now we continue with aficamten, as well as other medications in the pipeline, including energy modulators and what you will hear about soon, which are gene therapy programs that are being developed as well. And so we are also hoping in the next year or so that we go back to hosting you in person. These meetings typically are focused on patient education and awareness, as well as creating a community for our patients. And then we also try to invite providers and physicians who take care of HCM patients so that we can further the care of everyone in our community across the beautiful Pacific Northwest. I want to wrap this up by thanking all of you for making us better and for moving the field forward, and for the HCMA who continues to advocate for you, us, and raising awareness for HCM. Thank you from the OHSU team, and please do not hesitate to contact me or any of us here at OHSU if you have any follow-up questions. Thank you.
And now we're going to hear from our newest acquisition, Le Bonheur Children's Hospital.
Hi, I'm Dr. Jeffrey Tobin, Chief of Pediatric Cardiology and Executive Co-Director of the Heart Institute here at Le Bonheur Children's Hospital, and I'm the Medical Director of Cardiomyopathy at the same institution. We've gathered our team here to discuss our care of hypertrophic cardiomyopathy and other myocardial disorders, and I'll allow the team to give you some of the specifics. Sitting next to me is Dr. Hugo Martinez, and I'll ask Hugo to take it away from here.
Thank you, Dr. Tobin, and greetings, everybody. My name is Hugo Martinez, and I am an associate professor at the University of Tennessee Health and Science Center. Clinically, I am a pediatric cardiologist with a subspecialty in advanced cardiac therapies, and I am the co-director of the hypertrophic cardiomyopathy program. The highlights of our program include the fact that the medical management has been quite successful in our patient population, to the point that very, very few patients have had the need to undergo the implantation of ICDs or the need to undergo myectomy. Second, we also have keen understanding about the syndromic causes of hypertrophic cardiomyopathy, the so-called phenocopies, which includes several metabolic diseases that can mimic hypertrophic cardiomyopathy. This is an important topic because the management requires a multidisciplinary team able to understand the natural history, the diagnosis and management of such diseases like Noonan syndrome, Pompe disease, and many other errors of the human metabolism. And number three, we incorporate genetic testing to delineate accurate diagnosis and provide genotype screening of family members at risk. And with that in mind, I would like to introduce the rest of our team members.
Hi, my name is Mohammed Absi. I'm an Associate Professor of Pediatric Cardiology at Le Bonheur Children's Hospital. Le Bonheur is proud to provide a comprehensive service in a multidisciplinary fashion. We are so lucky to be able to utilize subspecialty services such as cardiac electrophysiology, advanced cardiac imaging, cardiac rehabilitation, and cardiac surgery, in addition to the genetic and interventional cardiology.
I'm Caitlin Ryan. I'm one of the Associate Professors of Cardiomyopathy and Heart Failure Medicine at Le Bonheur Children's Hospital. We would like to graciously thank all of our referring physicians and institutions for their continued support. Without their confidence in our abilities, we would be unable to provide the complex and an expert level of care that this patient population deserves. Most importantly, to our families of our dedicated patients and parents, you continue to be the most valued members of our team, and without you, we would not be able to achieve the success our institution strives for.
Hi there, my name is Jenny Strelson. I'm the nurse practitioner for the Cardiomyopathy and Heart Transplant Program at Le Bonheur Children's Hospital. Today we're very excited as a team to share the news that we are now not only recognized as a designated HCMA Center of Excellence, but also the first freestanding pediatric program to receive recognition from the HCMA. We would like to extend our gratitude to the HCMA for the trust and the opportunity to continue collaboration. In particular, we would like to thank Lisa Sahlberg for her passion for individuals and families affected by hypertrophic cardiomyopathy.
Well, that was nice. Okay, Ascension Health, St. Thomas. Let's hear from Dr. Zanker.
I'm Dr. Mark Zinker. I'm the director of the HCM program at Ascension St. Thomas in Nashville, Tennessee. Greetings. We are very happy to be here as part of the HCM Awareness Day, and this has been sponsored in part by Lisa Sahlberg. I'd like to thank Lisa and the HCMA group for being such an advocacy group for the HCM community. We have several people in my team that make it, I think, a worthwhile adventure to come to St. Thomas Heart. Annie Radonsky is my physician assistant. She came from the Yale program, has been with me now for 3 years, and will talk at the end of my discussion of the other exciting things we have here at Ascension St. Thomas. We follow over 2,000 patients throughout Middle Tennessee and the southern states. We have several things to offer as far as a high volume CT surgery center for septal myectomy. through Dr. Evelio Rodriguez and Dr. Chandra Maya. If people need alcohol septal ablation, Dr. Andrew Morse is a high volume operator trained through structural cardiology and an expert in that particular treatment option. In addition, we have electrophysiology, a very active EP program. Dr. Lugo heads up the leadless pacemaker program, VT ablation, and also has helped us with a novel technique of doing endomyocardial radiofrequency ablation if alcohol septal ablation is not suitable because of coronary anatomy issues. Dr. Baker heads up the atrial fibrillation ablation, and we're a very active center in that regard. We have had a full-time genetic counseling service, and this is a very important part of your experience here at Ascension St. Thomas, and Smith Arreo heads up that effort. In addition, we have psychiatry, a very active mental health program. Dr. Ron Solomon is our head psychiatrist that helps with those issues. We have a very active heart transplant and LVAD program. Dr. Dom Chomsky heads that up, and this is an option for patients if they need that through Ascension St. Thomas. We have been very involved with the myosin inhibitor medication. We're very excited, as are others, about Camzyos, and we're looking at other opportunities with other drugs through clinical trials, and we have that as an available option for patients with obstructive hypertrophic cardiomyopathy. We have been involved with the Maverick trial, the Valor trial, and now are also doing 2 other clinical trials with myosin inhibitors. We are very involved in the Camzyos REMS program, and as part of the St. Thomas experience, if that is a drug that would be useful for you, we are using that frequently in patients with symptomatic obstructive hypertrophic cardiomyopathy. Very excited to have Annie Radonsky then talk about some other things we have in the HCM world through Ascension St. Thomas Heart.
Hello everyone, my name is Anna Radonsky. I have been a cardiology PA for 21 years now. I am very fortunate to have the experience of working at 2 Center of Excellence programs. I started my HCM experience at Yale with Dr. Dan Jacoby. I was involved in Pioneer and Explorer and Maverick. I then ventured out to Nashville, Tennessee to join Dr. Zenker in his amazing HCM program, and we are just growing and growing and growing. So much that we have now hired an HCM coordinator. Her name is Jamie Belden. She has been a nurse for 24 years. She has experience in critical care in taking care of HCM patients post-myectomy and transplant patients. She has also been a case manager, so she knows how to handle a lot of the issues that happen with HCM patients and the complexity with this disease. We also here at St. Thomas have a HCM support group. We meet once a month on a Tuesday evening, and we have different speakers come and talk to us about HCM, different doctors, myself, Dr. Zenker, the EP physician. So it's really a great experience for our patients to get to know one another and also support for their spouses and family as well. Thank you very much to Lisa and the whole team for putting together this amazing HCM Awareness Day. Thank you.
We're going to hear another HCM warrior story now. This is Lauren. She was first diagnosed when she was 16 years old back in 2000. Again, a heart murmur was detected. After this was detected, her father was screened and found to have HCM. And to throw a little bit of a monkey wrench in this story, shortly after that, her mother's cousin was diagnosed with HCM. So I often use a little bit of humor here that our 1 in a million may be one of the other 1 in 500 or 250 as the number is changing. So it is possible to have HCM run down both sides of your family tree. So finally in 2005, she visited an HCMA recognized Center of Excellence and an ICD was recommended. Thank God that it was. 7 years later, while eating ice cream with her boyfriend, now her husband, her ICD appropriately fired, saving her life for the first time. Today, she's managing atrial fibrillation, and as she says, she's trying to live a normal-ish life. So Lauren, thank you for sharing your HCM story with our community. We truly appreciate you and your husband. We just need to take a moment here to recognize that those of us with HCM need a lot of extra support from our families, our friends, our spouses, our partners. And it's really meaningful to have people by your side through the journey that understand, appreciate, and can help when things aren't so easy. So thank you to the boyfriend turned husband. I have one of them too. So thank you, Lauren. Next, we are going to hear from our partners at Women Heart.
Happy HCM Awareness Day from all of us at Women Heart. We're a patient-centered organization focused on supporting, educating, and advocating for women living with or at risk of heart disease. We are so pleased to be partnering with HCMA and the entire HCM community to raise awareness about this specific type of heart disease that all too often goes undiagnosed. As an organization, on this day and every day, we are committed to raising awareness about HCM, to lifting up the stories and the voices of women living with HCM, also who are managing the disease, and those who are thriving. I encourage you to go to our website at womenheart.org to read a blog on HCM entitled When Heart Disease is Genetic. I want to thank and congratulate HCMA and Lisa and her entire team for making today HCM Awareness Day.
Thank you. Thank you, Cecilia. Oh, wrong way, Vanderbilt. We're staying with Tennessee for a while, people. Let's hear some more from that state.
Hi, my name is Dr. Marshall Brinkley. I'm director of the Hypertrophic Cardiomyopathy program here at Vanderbilt University Medical Center. On behalf of the program, we would like to thank the Hypertrophic Cardiomyopathy Association for inviting us to join HCM Awareness Day. We have a few program updates I'd like to tell you about. First, we've seen growth in our program over the last year or two, which is exciting because it means that people with HCM have access to comprehensive care. Two, we have a great specialty pharmacist, Amanda Kibbins, who's been helping us prescribe and monitor mavacamten to make sure patients have access to that. Number three, as part of our effort to advance the field of HCM, we're participating in this clinical trial Sequoia for aficamten. Dr. Stevenson has an additional word about some research updates in just a moment. And we also have a few personnel changes recently here. Dr. Michael Baker, the Director of Adult Echocardiography, is helping to ensure optimal imaging quality and interpretation for our echocardiogram studies. Dr. Kashish Goyal in Interventional Cardiology is specializing in structural heart disease, including alcohol septal ablation, and he'll introduce himself in just a moment. And Becky King, our clinical nurse navigator, has joined us in the clinic.
I'm Lynn Warner-Stevenson, the co-director of the Hypertrophic Cardiomyopathy program here. I was in Boston for much of my career, but I came to Nashville because of all the exciting opportunities here, in part with this program. This is an exciting time to care for patients with hypertrophic cardiomyopathy. The HCMA has made a profound impact on this field by raising awareness among patients and their primary physicians who now realize the importance of specialized HCM care. We're seeing more patients every week. It's a privilege and a joy to take care of you and your families because there's now so much to offer. The availability of mavacamten has excited our patients, now with access also to aficamten for investigation. With such benefit for symptoms and quality of life as well as for heart function, we are a little disappointed that we still face considerable problems with reimbursement for these breakthrough drugs. We see many patients who bring a diagnosis of hypertrophic cardiomyopathy, but in fact need treatment for other serious heart diseases that have not been recognized. These are sometimes structural diseases of heart valves or congenital heart disease. Our surgeons are experts with outstanding success with the septal reduction surgery, but also with the complex mitral valve, aortic valve, and other reconstructions. We're also world-renowned for our cardiac genetic program, now performing all the genetic tests here on site in the Vanderbilt laboratory with results that are faster and more private. Many patients come to us with complex genetic profiles that turn out not to be hypertrophic cardiomyopathy or to be hypertrophic cardiomyopathy modified by other inherited heart conditions. Vanderbilt is at the leading edge of genetic analysis for cardiac disease in populations and for families with rare cardiac diseases. We look forward to learning about how we can help you or members of your family.
My name is Kashish Goel. I'm a structural and interventional cardiologist at Vanderbilt University Medical Center. I trained in cardiology, interventional cardiology, and structural cardiology at Mayo Clinic in Rochester, Minnesota, which is one of the largest hypertrophic cardiomyopathy programs in the country. And one of my mentors, Dr. Rick Nishimura, was a prior chair of the guidelines as well. I have been involved in the HCM program since joining Vanderbilt at 2018. I particularly perform hemodynamic heart catheterizations to see if patients are symptomatic despite medical therapy from their HCM, and also perform septal ablation, which is a treatment for hypertrophic cardiomyopathy in a less invasive form as compared to septal myectomy. In addition to this, I also perform PCI, which is opening blockages in the heart arteries, and valve procedures for valvular heart disease.
Hi, I'm Becky King. I'm the nurse navigator for Vanderbilt's Hypertrophic Cardiomyopathy Clinic. I have been in a nursing field for 20 years, more recently in Vanderbilt in the HCM clinic, where it's very interesting. I learn something every single day. My role here is to help with coordination of appointments, testing, follow-up, making sure the patients have everything they need.
Finally, we'd like to join the HCMA in encouraging everyone to get informed about HCM and to encourage family members to get screened.
Fantastic. Next, Leahy, I'm going to turn off my camera for a minute and let you watch this great piece.
Hypertrophic cardiomyopathy occurs in about 1 in 500 individuals in the general population. That being said, the majority of patients with HCM go undiagnosed.
The muscle of the heart, predominantly the left lower chamber of the heart, what we call the left ventricle, has an increase in wall thickness. And that increase in wall thickness with the changes at the cellular level can put some patients at increased risk in some point in their lifetime for a number of different adverse outcomes.
There's a wide spectrum in hypertrophic cardiomyopathy, and we see patients who have very little symptoms to those who are highly symptomatic and need some type of intervention.
Leahy offers the spectrum of treatment for patients with hypertrophic cardiomyopathy. We're fortunate in terms of we have a world-class myectomy surgeon with Prem Shaker. We have excellent interventional cardiologists for alcohol septal ablation, and we have an amazing electrophysiology team for ICD care and for treatment of atrial fibrillation.
The way that we have structured the HCM Center at Leahy, at the core, you've got a group of world expert HCM cardiologists, myself, Dr. Ethan Rowan, and my father.
I've been focused on one disease for 50 years. Here at Leahy, we've had a primary role in changing what HCM is.
For some years, I'd had shortness of breath, extreme fatigue, profuse sweating, feeling faint with pretty moderate activity, sometimes even fainting. It seemed like I was taking one of each type of heart control medication, and it still wasn't having an effect. My cardiologist immediately referred me to the Leahy Hospital and Medical Center for HCM treatment.
We spend a lot of time trying to understand for each individual patient what may be the biggest driver in terms of what's making them feel poorly, so that we can be as effective as we can in directing therapy at improving that patient's outcome.
One of the most important programs that we've grown here has been the hypertrophic cardiomyopathy program, particularly on the surgical side. We can see the area of the thickened muscle, which bulges below the aortic valve. Working through that narrow confines of the aorta, we are able to reach that area of the thickened muscle and take out enough muscle to relieve the obstruction.
After trying medicinal approaches and alcohol ablation, we decided on going with a septal myectomy, which solved all my problems completely.
Within 2 to 4 weeks, they are dramatically better. They are no longer dizzy. They are able to walk increasing amounts of distance without being short of breath. Their life is transformed.
When I read people's anecdotal stories about HCM treatment, almost everybody had difficulty with the diagnosis because, again, there wasn't a specialty department. People also had to travel for treatment. And so I felt blessed that I neither had to travel for treatment and had world-class doctors right here.
In many ways, the Leahy Hospital Medical Center is really responsible for the research and knowledge behind treating HCM patients.
We're always changing. We're always 2 steps ahead. We're always trying to think of ways to improve patient care and patient management.
And when we apply that kind of expertise and experience to the disease, we can really provide patients a chance to really achieve what they want out of life while still living with HCM.
I am Bipul Vaibhav, and I am the director of the Hypertrophic Cardiomyopathy Center of Excellence. We are in Rochester, New York, and we are the only hypertrophic cardiomyopathy center of excellence in Western New York. We established our center in 2019 as I felt that there was a need to provide comprehensive care to patients with hypertrophic cardiomyopathy in this region. Prior to our center, patients needed to travel more than 300 miles to get to a center of excellence, but now we are able to take care of patients with hypertrophic cardiomyopathy and their families in this region. We provide comprehensive care to patients with hypertrophic cardiomyopathy. We provide state-of-the-art imaging, which includes echocardiography, transesophageal echocardiography, cardiopulmonary stress tests, cardiovascular MRI, and invasive angiography. We provide arrhythmia services. We also have a dedicated genetic counselor who provides services for family screening and genetic testing and counseling. We provide invasive therapies such as alcohol septal ablation, septal myectomy, mitral clips. Over the past few years, we've seen 450 patients and their families with hypertrophic cardiomyopathy. We are also involved in some research with regards to special techniques in cardiac imaging with regards to cardiovascular MRI for patients with hypertrophic cardiomyopathy. And also we have enrolled patients with hypertrophic cardiomyopathy who have diastolic dysfunction for certain trials. We have around 20 patients who are on the novel therapy, mavacamten, for hypertrophic cardiomyopathy, and we are seeing good results. We partner with the Hypertrophic Cardiomyopathy Association, and the Hypertrophic Cardiomyopathy Association has really helped us as a young program to connect us with experts around the country, such as Dr. Naidu and Dr. Lever and Dr. Martinez, so that we can provide high level of care to patients who have HCM. Ludmila Kuchma is our nurse practitioner, and she is very dedicated towards our patients.
Hi, my name is Ludmila, and I am an advanced nurse practitioner in our Hypertrophic Cardiomyopathy Center of Excellence. I help to provide care for our patients with Dr. Bipul Vaibhav. Every patient with hypertrophic cardiomyopathy is unique. The manifestation of hypertrophic cardiomyopathy can be highly variable. It can range from patients who have no symptoms at all to those who have severely limited symptoms, including arrhythmias. In our hypertrophic cardiomyopathy clinic, we try to provide the best care we can for our families and patients with hypertrophic cardiomyopathy. We spend significant time with each patient and their families, talking about their disease, addressing their needs, and helping them to improve their symptoms and quality of life.
Symptoms of hypertrophic cardiomyopathy, as Ludmila said, can be very variable, ranging from chest pain, shortness of breath, lightheadedness, episodes of fainting, palpitations, or fatigue. Hypertrophic cardiomyopathy can be seen in up to 1 in 200 people. If you have any of these symptoms and there is no explanation for your symptoms, make sure you ask your doctor about hypertrophic cardiomyopathy. If you have a family member who has been diagnosed with hypertrophic cardiomyopathy, you may be a candidate for screening to make sure you don't have this condition. We take pride in taking care of patients with hypertrophic cardiomyopathy, and we are now able to provide comprehensive care to patients with hypertrophic cardiomyopathy in Western New York. Thank you.
Hello, I'm Trudy Loban from the Arrhythmia Alliance, the Heart Rhythm charity. I've known Lisa and HCMA for 20 years, and I've always admired the work of the organisation. And like Lisa, the passion and the commitment that we both have to improving outcomes for patients. This coming year, HCMA and Arrhythmia Alliance are going to be working in partnership on raising awareness of atrial fibrillation, the most common heart rhythm disorder, and 25% of people with HCM go on to develop AF. So I look forward to meeting many of you, and thank you for supporting HCMA with their Awareness Day. It's so needed. We need to raise much more awareness and improve the outcomes for all.
And guess what time it is, ladies and gentlemen? Here's that QR code again. Just reminding you that we need your support financially as well as your time. If you'd like to go to the HCMA website here on the screen now and sign up to become a volunteer, you can participate and share your story. You can be a legislative advocate. You can help us in one of our committees. There's so many things that you can do and give a little bit of your time to help a bigger cause. So please get involved, stay engaged with us. We've got lots of great projects coming up, and you're going to hear about some new ones tonight too. Next, we are off to Florida.
Greetings. My name is Marcos Caste. I'm the medical director for the hypertrophic cardiomyopathy program at Advent Health in Orlando. I want to take this opportunity to thank Ms. Lisa Salmer and the Hypertrophic Cardiomyopathy Association for the invitation to participate in the Hypertrophic Cardiomyopathy Awareness Day. I first met Lisa in 2009 during a Hypertrophic Cardiomyopathy Summit in Minnesota. In 2010, was recognized as a Center of Excellence. Since then, my cooperation with the hypertrophic cardiomyopathy has made our program grow by leaps and bounds. I has been asked to mention what's new in our program. We have a new location. In this particular location, I have been offered the support that a hypertrophic cardiomyopathy program need all in one area. Our patient can have a pacemaker or ICD clinic, can have follow-up echocardiograms, can have a stress echocardiography for risk verification, and can also have chest pain evaluation with a nuclear cardiology, as well as genetic testing and counseling. We are very excited to have been asked to participate in a new trial of a myosin inhibitor, and want to conclude by describing my new project, which is coordinating with Dr. Naveen Bellan in amyloidosis program. As you know, amyloidosis is a phenocopy of hypertrophic cardiomyopathy, and a percentage of our patients with hypertrophic cardiomyopathy may actually have amyloidosis. I want to conclude by reminding that the symptoms of hypertrophic cardiomyopathy are very non-specific and shared by many conditions. Patients that present with shortness of breath, chest pain, palpitations, or dizziness, even syncope, may have a large differential diagnosis. Having a program with the expertise to navigate the patient to the correct diagnosis and management is very important. And in this regard, the Hypertrophic Cardiomyopathy Association plays a great role. Often, the patient leaves the office with many questions unanswered, possibly because they didn't think of it at the time of the visit. And then they always can call the Hypertrophic Cardiomyopathy Association to get more information. I have enjoyed immensely my association with this society and look forward to continue to participate in future programs.
Hi there, my name is Dr. Victoria Parikh, and I'm the director for the Stanford Center for Inherited Cardiovascular Disease and HCMA Center of Excellence. I want to thank the HCMA for their sponsorship and organization of this fantastic Awareness Day. We're really excited to be here. So I'd like to start by telling you a little bit about who we are and what we do at the Stanford Center for Inherited Cardiovascular Disease. We are a group of physicians, nurses, and genetic counselors who specialize in the care of families with genetic heart disease, including hypertrophic cardiomyopathy, for which we care in our Stanford HCM Center. The physicians, genetic counselors, and nurses that are pictured on the right make up the leadership of our Stanford HCM Center. I am the director of the Center for Inherited Cardiovascular Disease. Ewan Ashley is our founding director, and Matthew Wheeler and Kareem Salam are also both cardiomyopathy specialists that see patients in our HCM Center. In addition to our cardiomyopathy specialist shown at the top here, we have Marco Perez, who is an electrophysiologist specializing in the care of patients in particular with HCM, including atrial fibrillation and the need for implantable defibrillators. And then Will Hiesinger is our fantastic myectomy surgeon. He is super skilled and has a wonderful bedside manner and does a high number of myectomies and mitral valve surgeries for HCM patients every year. We also have Julia Platt here. She is our lead genetic counselor. We have the largest team of cardiovascular genetic counselors in the world. Julia leads them to provide not only genetic diagnosis, but also significant and important education to our patients around the diseases that run in their families. And then pictured over here on the right is our fantastic program operations lead, Heidi Salisbury. She is an advanced practice nurse with more than a decade of experience in caring for patients with hypertrophic cardiomyopathy and other familial cardiovascular diseases, and really does an amazing job in patient advocacy, education, and the operations of our clinic running smoothly. Over here on the left, I'm picturing our website. This is a little bit of an old picture, but this family, the Jacques family, really epitomizes what we do in our HCM Center. We are really focused on caring for families from a multidisciplinary perspective that includes genetics, as well as the care of their hearts. We've had the privilege of caring for this family for many years, over multiple generations, and they have even given us the opportunity to help them identify the genetic cause of their disease, which had never been reported before. So with that, I'd like to talk about the power of genetics and hypertrophic cardiomyopathy. Here you can see an example of what we call a kindred or a family tree. At the top, you see the grandmother and grandfather. Men are in, or rather male patients are in squares and female patients are in circles. You can see that one of their daughters was diagnosed with hypertrophic cardiomyopathy. Now, because hypertrophic cardiomyopathy is a genetic disease, we know that this patient's first degree relatives, meaning her parents, her siblings, and her kids, are at 50% risk of inheriting a genetic variant that could lead to hypertrophic cardiomyopathy, and that their next generation, or two steps removed from this patient, are at 25% risk of inheriting a genetic variant that might actually cause HCM. So what we want is to be able to detect HCM early in these family members, but also to resolve uncertainty that they might carry about their risk of developing hypertrophic cardiomyopathy later in their lives. We can do this with genetic testing when we can find a genetic variant in an HCM patient. For this patient, we were able to find a variant, and that allowed us to actually identify her first degree relatives who carried that variant and absolve those that didn't, as well as their children, of lifelong testing and uncertainty about their diagnosis. So genetic testing can be a really powerful tool in caring for families with hypertrophic cardiomyopathy. We also recognize that living with hypertrophic cardiomyopathy is challenging, not just from a symptom perspective, but from the perspective of uncertainty and understanding one's disease. It takes a lot of courage, and it also takes a lot of support from your community. At Stanford Center for Inherited Cardiovascular Disease, we work closely with staff psychologists who can be extraordinarily helpful both in dealing with diagnosis in patients and family members of HCM, as well as guiding patients through how to make big decisions around whether or not it's time to implant an ICD or defibrillator, as well as surgical planning. And then lastly, and I think this is super powerful, we have some really amazing patients, just like members of the HCMA, who are really invested in their HCM community and provide peer-to-peer mentorship. In fact, we've developed a Stanford Cardiomyopathy Patient Support Group. It meets virtually on the first Monday of the month at 6 p.m. If you're interested in being involved, it's a great experience. We have a brief lecture from a guest speaker, and then breakout sessions for dilated and hypertrophic cardiomyopathy. If you'd like to attend one of these support groups, you can use the QR code that's depicted here or email familyheart@stanford.edu. On the clinical side of things, we recognize that cardiac myosin inhibitors were coming down the pipeline for hypertrophic cardiomyopathy patients years before they were approved by the FDA, and we were ready to make this a possibility for treatment for our patients with obstructive hypertrophic cardiomyopathy. This was a program that was led by Heidi Salisbury, our fantastic program operations lead. She made sure by the time that the first cardiac myosin inhibitor was approved by the FDA that our patients would have access to it. And we do this via a really invested medical team, including patient flow coordinators, patient care coordinators, nurses, and echocardiographers, all the way up through the MDs, who have a routine not only for identifying patients who are candidates for ththese medications, to helping them get the prior authorization needed from their insurance companies, and then pushing them through the pathway that includes echocardiograms to monitor their progress and dose adjustment. We've enrolled over 60 patients on cardiac myosin inhibitors, and we're seeing really great results. We have a quote from one of our patients here: "Tears come to me often these days. I feel like I've been given such a gift and that life is just beginning. This is definitely a game changer for so many. I look forward to doing all the things I've missed for so long. Thank you and the team for being by my side." And that's what we want to do at our center, is be by the side of our patients with HCM. In that vein, we always encourage safe exercise for our patients with hypertrophic cardiomyopathy. We believe that exercise is the best drug for a long and happy life, as long as it's done in a safe way. Mild to moderate intensity exercise we know is very safe for patients with hypertrophic cardiomyopathy, as long as it's done under the supervision and guidance of a physician who specializes in HCM care. We at Stanford have a cardiopulmonary exercise lab that we direct that can help our patients learn how to exercise safely and effectively with HCM. We have every year a fun run and a 5K. You can see the picture of that at the top of the slide, where we raise funds for patients with families, patients and families with HCM. We hope that you'll join us. You can find more information at myheartcountsrun.org. And with that, I want to say thank you so much for your time and for the opportunity to be here. Thank you again to Lisa and all of the organizers of this amazing Patient Awareness Day. Thank you so much.
Let's head down to Texas.
Hello, I'm James McNamara, cardiologist and the newest member of the UT Southwestern HCM Center of Excellence. I'm honored to speak with you on behalf of our team during Heart Month and on HCM Awareness Day. The motto of UT Southwestern is the future of medicine today, and this perfectly applies to the care of patients with HCM. Never before have we had so many options to help patients with HCM live the lives they want to. And here at UT Southwestern, that's our mission, to personalize care, to let each individual patient minimize symptoms and maximize safety and live the life they want to live with HCM. And the goals of patients can range widely, from competing in elite sports to just feeling less breathless when they walk. UT Southwestern, we aim to provide comprehensive care for patients with HCM to achieve these goals. Dr. Aslan Terrer leads our clinical team. Dr. Mark Link is the leader in the management and prevention of cardiac arrhythmias for patients with HCM. Dr. Chris Hyde has joined the team to provide surgical options. And my goal is to help patients with HCM be more active, whether we're engaging in a shared decision-making process to help patients exercise safely, or helping reduce patients' breathlessness and improving their quality of life. And within the last year, we've seen the first drug specifically designed for HCM. Mavacamten hit the clinical market, and our team, led by Dr. Terrer, has been providing mavacamten since its approval with fantastic results. Patients who were previously limited by breathlessness can now be more active. And the team, including myself, Anuja Matthews, and our pharmacy team, Aaron Davidson and Eric Rodriguez, are working to make the process of getting mavacamten as easy as possible. But as the future of HCM care evolves, we're pushing the boundaries to better understand and treat this disease. We're part of several ongoing clinical trials, including Sequoia, which is testing a second-generation drug, aficamten, and Odyssey, which is testing mavacamten for patients with non-obstructive HCM. The results of these trials will be critical to the future of the treatment of patients with HCM. And right here at UT Southwestern, we've recently completed the high-intensity interval training in HCM study, which compared the safety and effect of high-intensity interval training with moderate-intensity exercise in patients with HCM. The study, performed right here in this lab, showed that patients with HCM can perform high-intensity exercise to improve their fitness. And we're designing more studies to understand how HCM impacts patients' quality of life and ability to exercise so that we can minimize symptoms and maximize fitness and physical activity. So on behalf of our entire team, thank you for the honor of speaking today.
Thank you. And more late breaking news. To have your attention, we have late breaking news. We just heard from 2 programs in Tennessee, and Tennessee State House has just, Tennessee at the Senate Health and Human Services Committee meeting just voted in favor of HCM Awareness Day. I don't know that we're fully to the finish line yet, but we are out of the Health Committee and on our way in Tennessee to HCM Awareness Day recognition. So thank you to Tennessee. Let's bring it home. And let me double check to make sure there are no more late breakers coming our way. We've only done this, we've had 3 late breakers since we've been here today. So that's what I've got. So thank you. Back to the program. Let's go back in there and see what's next. It's me. So we're going to talk about one of my favorite stories ever. Christine lives out in Washington State. And her story was one of the more dramatic stories that I had heard early on in the HCMA's programming. She was actually one of our Share Your Story patients at one of our in-person meetings, which, by the way, are coming back. I'll talk about that in a moment. So she was diagnosed with HCM when she was 24 years old. She went on to have a few children. Her mom passed away from heart failure at 59, never confirmed HCM diagnosis, but we suspect. And one day, Christine woke up in a hospital and she couldn't remember what happened that led her to the hospital. So she figured the only time she'd really been in the hospital up to then was to have children. So she thought she must have just given birth and was a little confused. She wasn't there because she had had a baby. She was there because one of the most dramatic things that could possibly happen in an HCM family happened to her. Number one, she was working out on a treadmill at her home, and she passed out. And unbeknownst to her or her son at the time, who was quite young, she had gone into cardiac arrest. Her son was her first responder and got EMS there promptly, and mom woke up in the hospital and got an ICD implanted. And her device has appropriately fired since that day. She has 2 children living with HCM and ICDs, and another special needs child who has a different status. So I just love the resiliency of this family. I love the attitude in the hospital. Christine is a true warrior. She might be tiny, but boy, is she mighty. So Christine, thank you for sharing your story on HCM Awareness Day. Off to Atrium Health. Let's see what's going on in the Carolinas. What did I do? I broke it.
Hello, and thank you for joining me today to celebrate Hypertrophic Cardiomyopathy Awareness Day. I'd like to begin this by thanking Lisa Solzberg and the HCMA for all the incredible work they do for advocating, supporting, and educating the hypertrophic cardiomyopathy population that we all care for so much. My name is Dr. Dermot Phelan. I'm the Medical Director of the Hypertrophic Cardiomyopathy Center at Sanger Heart and Vascular Institute, Atrium Health, in Charlotte, North Carolina. I joined Sanger in 2020. I spent the prior almost 10 years working at the HCM Center of Excellence at the Cleveland Clinic. And in over 20 years of experience in helping patients with hypertrophic cardiomyopathy, I've learned a few valuable lessons that I think we try to institute every day in our clinic. And the first is that this diagnosis can be scary. When people get this diagnosis initially, it can be quite traumatizing. And I think the way to address that is through education. The second thing is that hypertrophic cardiomyopathy manifests itself in a multitude of different ways. So the expression of the disease is very different from person to person, and even within members of the same family. And so the education that we provide has to be very specific and tailored to that specific individual. I think anyone who gives us the honor of allowing us to look after them here at Sanger will recognize that we spend an awful lot of time going through the imaging and going through the specific disease of that individual. Because individuals have very different management issues, it really requires a team of people to provide that care. And over the course of the next couple of minutes, I'm going to introduce you to many of the members of the Sanger Hypertrophic Cardiomyopathy Center. I think the care journey always begins with making sure we've got the correct diagnosis. And unlike what many people think, making the diagnosis of HCM can often be challenging, as there are a lot of subtleties and nuances here. And there is wide variability in the imaging qualities across centers and across the country. I'm standing in our brand new building in Kenilworth in Charlotte, where we have a state-of-the-art advanced imaging center that has all of the top modalities available, including magnetic resonance, CT, echo, and cardiopulmonary exercise tests, all on one floor on the second floor here in this building, and our clinic is on the third floor. So it really makes it easy for patients to come to a one-stop shop and get all of their imaging in one spot. I had the honor of being the chair of the multimodality imaging guidelines for the diagnosis of hypertrophic cardiomyopathy. So this is something that I think we really do have expertise in and we're very passionate about. And patients who come in will realize that we spend a lot of time looking through their imaging to make sure that they understand their anatomy and that we have the right diagnosis. Recently, we've begun creating 3D models of the heart to try and help patients understand that anatomy even better. Once we have the diagnosis secure, the next step is to understand the implications of that diagnosis for the patient's family. And we're fortunate enough to have an expert geneticist, Dr. Sumi Joseph, attend our outpatient clinics with us, and they can see patients on the same day or via telehealth at a later time. Now, as I said, patients will have a variety of different ways that their disease, the HCM, will manifest itself, and many of those it will be very mild and they won't need anything special or in particular to be done. We can reassure them and just make sure that they're followed up over time. For others, they may have electrical issues, and we have a team of electrophysiologists who have an expressed interest in hypertrophic cardiomyopathy to help these patients navigate device selection if they have complications with their devices, or to manage things like atrial fibrillation, which is managed slightly different in patients with HCM than in others. Some individuals will have left ventricular outflow tract obstruction, or LVOT obstruction, and there are a range of different options for treating this. We will always begin with medical management. Recently, we've seen the advent of a new therapy called Camzyos, or mavacamten, and we have a team of providers that can help individuals get set up to take that medication. If medical therapy fails, then we have a range of options in terms of septal reduction therapy. We are one of the very highest volume centers in the country doing septal myectomies, and Dr. Larry Watts is our cardiothoracic surgeon with an expressed interest in HCM. If patients wish to undergo alcohol septal ablation or even some novel therapies such as MitraClip, Dr. Jonathan Schwartz is the medical director of our interventional lab and an expert in these procedures. Unfortunately, some patients with hypertrophic cardiomyopathy will go on to develop more advanced heart failure, and we do have experts in this area, Dr. Joe Mishkin, Dr. Shuk Nankilar, who are both advanced heart failure experts and have an express interest in the management of hypertrophic cardiomyopathy. As a center, we are very passionate about pushing the boundaries in terms of the care of patients with hypertrophic cardiomyopathy. We are running multiple trials looking at novel therapies to treat individuals with different types of complications for HCM. And I think this is one of the advantages of coming to a center like ours, where patients will have access to these novel therapies. There are many other individuals that you will meet. Dr. Lucy Rashid is our PA, who is an expert in hypertrophic cardiomyopathy. Our nurses, MAs, social workers, pharmacists, schedulers, everyone works together as a team to make your visit here at Sanger as seamless and as meaningful as possible. So we all want to thank you, the patients, for trusting us with your care. I'd like to finish by thanking a very special individual. Dr. John Samansky has spent his career establishing the Center of Excellence for HCM at Sanger and is a passionate advocate for patients with this disorder. John has been a mentor and a friend to many, and John is retiring soon. So on behalf of all of the members of the Sanger team, and I think I can say on behalf of all of the patients that Dr. Samansky has looked after, we wish him the very best for the future. I believe that the future is very bright for patients with hypertrophic cardiomyopathy and for all of the providers that care for patients with this disorder. Please enjoy HCM Awareness Day.
I think we need to stop here for just a second and acknowledge the contributions of John Samansky to not only HCM care for patients in the region, but the development of the program. I was sorry to hear he was retiring, but that's the best we can hope for our friends, is that they get to retire and enjoy their retirement with their friends and family. So we do hope that John stays in touch with us. He's been a great addition to the HCM Academy project. So maybe we'll be able to keep them a little involved. I'll see what I can do. So thank you, John, and hopefully our paths shall cross again. Now back to the program. We're wrapping up this section and we're coming to a close soon for the afternoon session. I know this went a little bit longer than we originally advertised, but many of our centers ended up sending in content, which we weren't fully expecting. Oh, that's where I am right now. Okay, so now I'm into talking. So that was our last COE presentation for the afternoon. And I wanted to talk to you a little bit about the Drill Dr. Hart project. I talked about it earlier today, but that was a few hours ago, and some of you might not have been there. So the HCMA has had a program since 2010 called Drill Dr. Hart. And it was originally intended as a sports drill. We're going to be talking about it a little bit more tonight. But this is a way to prepare to respond to a cardiac emergency. So what we need you to do, obviously we want everybody CPR certified and AED certified, but variations of certification occur in each state. Excuse me, I have hiccups. I did good all day. Okay, so you want to make sure that you've got your AED training and your CPR training. Next, you want to have a planning meeting. This could be for a classroom. This could be for a workplace. It could be for a team. It could be for a congregation. It could be for a community event, a rec center. It could be anywhere where humans gather regularly. We have 4 categories that you can apply under on our social media platform. Number 1 is schools. Number 2 is workplaces. Number 3 is sports teams. And number 4 is community efforts, meaning rec centers, rec home, senior living facilities and their recreation centers or houses of worship. So you would take the community together and you would have a planning meeting and you would discuss what the rules and regulations and laws are in your state on who can perform CPR, where your AED is located, if you have an AED at all on premises. And if you don't, you may want to consider purchasing one, or you want to make sure that your EMS workers have a response time that is appropriate. So next, you want to discuss everybody's roles in the drill. We have a script for you on our website, and maybe somebody can drop that link in the chat. So all you need to do is go follow the script, and it tells you all the things you need to be prepared for. Then the challenge comes in. Then we want you to pull out your phones and we want you to videotape or video phone. It's not tape anymore, people. I'm getting old. We want you to video your Drill Dr. Hart in practice. So you want everybody doing the jobs. Somebody, is the victim and they go down, and then we have somebody starting CPR. Obviously, you're not really going to do CPR on them. Somebody's going to go get the AED. Somebody's calling 911. Somebody's going to the door to make sure EMS knows which door of the building to find you in. We put all of these things in play. The next thing that happens is you're drilling it out, you're filming it, and then you post it up to our challenge page, and then you share it on social media. So in each of the 4 categories, the person or the film that gets the most engagements will then be eligible to win an AED. And thank you to Defib Tech for offering up 3 of the AEDs as our prizes. We also have Morris 10 Medical Center offering 1 AED as the prize. So we have 4 AEDs to give away. If this endeavor is successful, we'll do it again next year and hopefully give away more AEDs. So we encourage you to join Drill Dr. Hart. Interestingly enough, coming in a comment, South Dakota codified law states that CPR and AED training is a requirement of graduation. Fantastic. We love to see that. But that's not enough. We appreciate South Dakota for doing that and all the other states that are requiring AED and CPR use to be a pre-qualifier for graduation. But when you're in the moment of panic, if you haven't planned all of the variables, you're going to have a problem because people aren't going to know what to do. And I'm going to tell you a story. Earlier today, I told the story of the difference between Damar Hamlin and Hank Gathers, what 33 years did to change a response on a sports field. I'm going to tell you another story that happened in New Jersey. There was a young man named Michael Ramos. He was in gym class at a Votech high school. It was a big campus. And he had a cardiac arrest in the weight room. The nurse in the school, there was a nurse on premises, as there are in all New Jersey schools, and there was an AED, and this is back 12, 13 years ago. The AED was there, but the nurse had just come back to school from having her hip replaced, and she had the AED, and she had to walk across a very large campus as a cardiac emergency was unfolding. While she was coming to the scene, an individual in the room with this young man who had a cardiac arrest said, nobody touches him until a nurse gets here. So nobody started compressions right away. There was a CPR certified adult in the room as a sign language interpreter, and she acquiesced to the teacher in the room as he had the position of authority. And compressions were not started immediately. They waited for the nurse to arrive. There was no way they were getting this young man back. He was a big guy, and it was hard to do compressions on a bigger chest. And he had already been down for a few minutes by the time the nurse got there. So we don't want to lose a moment. We want hands on those individuals immediately. We want 911 deployed immediately, and we want to start the chain of survival. We don't want to lose somebody else to an out-of-hospital cardiac arrest when we can do better. We can train, we can prepare, and we can take action. So I encourage you all to take the Dr. Hart Challenge, train it, talk about it, film it, post it, share it, and win an AED for your community. Now, if you're a larger business and you want to be involved, we would love to have you involved, but your larger business can probably afford an AED. So you can, if you are a large corporation, enter the challenge and then donate the AED to a community program that you choose. So as long as we go to a community program, we're good to go on that. Okay. And last but not least, so we haven't talked about this one much today. We talked about it early today. For those of you seeking to get to HCMA Recognized Center of Excellence Care, I am happy to say that the Lori Fund is well funded for this year, and we have many potentials for grants to give away this year. You can get up to $600 towards travel to an HCMA Recognized Center of Excellence or transplant program that they have referred you to. And that can cover a night in a hotel, a plane ticket, a train ticket, gas money, food on the road, whatever you need to get to that Center of Excellence appointment. So you can fill out the application online. There are certain criteria that you must meet to be financially eligible. But if you are a low-income individual, you are likely going to qualify. So please apply. We would love to give these grants out. For those who don't remember or don't know, Lori was my sister, and I waited for like 25 years to find a good program that I could put her name on. And as she was a single mom of two battling HCM, money was always a challenge. And I would hate to have seen she couldn't get to high volume care in today's world. We know she died from medical errors made in her HCM management. And we just don't want that to happen to anybody else. So please take us up on the Lori Fund. That is it for session 1 of HCM Awareness Day. We're going to take a little break here, and we're going to be back with you actually at 6:20. We're going to go live. We have a 10-minute video that we just didn't have time to fit into the agenda, so we're going to put that on early. So if you want to go, stretch, do a little work maybe grab a bite to eat and come back and join us at about 6:20. We have a jam-packed night of content for you. We're going to have some more discussion groups. We're going to show you some new projects. I'm going to give you a very brief State of the Union address, tell you a little bit about what else is going on here. And we really appreciate you all for joining us today. Barbara, just to answer your question that you posted earlier, sorry, I just had so much going on here. How do you advise diplomacy in suggesting cardiologists learn about HCM training program? So we have the HCM Academy program, which is medical education. And we encourage you to just ask your doctor to please take HCM education courses. They're free. They're available online. You can link them in through the HCMA's website at 4hcm.org. And hopefully we can get everybody educated and engaged in our new HCM, HCM Academy. Lots of HCMs here today, where we will be working on a webinar-based system that deploys twice a month. One on US time, one on UK time. And we're going to hopefully educate a lot of healthcare providers worldwide with the HCM Academy later this year. So I thank my staff for helping in today's endeavor. So we have a couple people that sick today, so I hope they feel better. And I'm really glad I'm not one of the ones who got sick this time. We also have tomorrow I get on an airplane and I go to California. I'm not quite sure who's going with me at this point. But we're going to go out and do another filming of a man called Otto. So if you have not signed up already, I can turn this off. We can just talk here. If you have not signed up already for the California event, it is in San Bruno, which is South San Francisco area. As of right now, I think we have 75 people coming to watch a movie with us. So we encourage you to come on out and enjoy. And hopefully we can oh, John Szymanski's here and he has his hand up. Oh, he's coming in. I'm promoting you to panelist, John Szymanski. I have promoted you. Accept the promotion. I hear my staff laughing. Come on, John, come on in. I'm promoting you. Promote to panelist. Accept the promotion. Are you live here? Where'd he go? There he is. Nothing like our only live person. John, unmute yourself and come on camera with me. 3, 2, here he comes, I think. John.
Hey, Lisa.
Hey.
Just want to say,
retiring? What's
yeah.
happening?
Hey, gonna see how the other half lives. But thank you for the shout out. Great program today. Really awesome stuff. And keep up the good work. I won't be a stranger.
Don't be a stranger because I got things I could keep you busy with. So sorry to hear that you're leaving. We actually got a couple of questions from patients who heard that you were leaving. They're like, what do we do now? And I'm like, he planned this. We've got some good people there who are ready to take care of you.
Indeed.
So we will be in touch. Do send me your new email because you'll probably get one in a couple of days. And that way we can keep in touch. And there's a lot of HCM education that still needs some skilled hands to deliver. So don't be a stranger.
Absolutely. All the best.
Thank you. And that concludes section 1 of the day. We'll see you tonight, everybody. Thank you all for joining. And if you're watching on YouTube, keep watching. We need to get our hours out.